Morning. Good morning. Good morning. Can you hear me?
Good morning.
Thank you.
Morning, everybody.
Morning.
Morning.
Good morning.
Brian, do we have all the board members except for Mr. Anderson and Dr. Atterbury?
Dr. Atterbury is joining right now.
Okay,
Yep. Once Dr. Atterbury joins, then we should be good to go.
okay.
Morning, Dr. Cleary. It's nice to see you.
Good morning. Nice to see you. Okay, it looks like we have Dr. Atterbury here as well. I'd like to call the meeting to order. Ryan, would you like to do the introduction?
Yes. So Commissioner Anderson will be absent today. Dr. Cleary, citizen
Present.
representative. Commissioner McKinney,
Present.
Commissioner Lindy,
Here.
Mayor Byers,
Good morning.
Councilmember Duval,
Present.
Dr. Atterbury,
Present.
and then Yakima Health District staff, Andre Fresco,
Here, thank you.
myself, Ryan Ibach, Chase Porter,
Here, good morning.
Melissa Sixberry,
Here.
Lillian Bravo,
Here.
Sean McGee. Sean McGee. Here. Good morning. Nathan Johnson. Good morning. Dr. Neil Bard. Dr. Bard on. Okay. James Elliott.
Good morning.
Victoria Reyes. I think Victoria is helping Dr. Bard with his computer. Jocelyn Castillo.
Here.
Okay. We're just waiting for Dr. Barg and Victoria.
Yes, apologies, Dr. Barg is having some connection issues, so we're working on that right now. Thank you for your patience.
Blame it on traffic.
I just blame it on tech stuff. I have connection issues a lot, so I understand. Commissioner McKinney, was that a reference to my hitting a 10 out of 11 traffic lights red coming to the meeting yesterday?
Well, that's what I mean, typically when we're always in-person meetings, the previous life that we had, it was always, oh, the traffic and the lights, and yeah, now it's slow internet rather than slow traffic lights.
Dr. Cleary, they're just getting on now. Would you like me to proceed with the written comments?
Yes, please.
Okay. So we did have 3 written comments, and those are on our website, and they have been sent to the board in advance. The first written comment was submitted for the August 11th meeting. However, it did miss the deadline. I did reach out to the person that submitted the comment, and she would still like it read at this meeting. So that one is from Teresa Hauser. Please provide the uncensored, peer-reviewed scientific evidence that demonstrates wearing a mask prevents the transmission of COVID-19 to others in our community, in particular those citizens aged 5 through 18 years old. Without the health board providing this documentation, a mandate on our children to wear masks in the classroom is putting a muzzle on their learning and social development. Parents have always been the legally responsible party for a child's welfare and discipline. Mandating masks in the classroom supersedes the parental rights, responsibilities, and obligations to care for their own child. Masks should be optional at the discretion of the parent. The next one is from Casey Core. I'm writing about the need for leadership in this period of increasing unrest over COVID and mandates to preserve public health. I worry about rising anger and the risk of violence in our community. I know several of you have expressed heartfelt concern about mandates. I respect your concerns for families, children, and businesses. We all cherish our freedoms. As members of the Board of Health, you have a responsibility to speak to those individual concerns, but you also have a duty to speak for our community as a whole and remind others that with freedoms come responsibilities. Since nearly all of you lack advanced medical training, you have an obligation to listen to the health officer and district staff and give proper weight to their years of experience and expertise before forming your own conclusions. Please keep politics out of the health district. In a pandemic, we all must make sacrifices for the greater good. Leadership means supporting health directives that are guided in science. Leadership means acknowledging that mandates issued during a pandemic are fully within the law. and always subject to judicial review. Saying otherwise just arouses frustration and anger that will only prolong the pandemic and increase suffering. Telling people there's no evidence that masks reduce exposure is both false and dangerous. It also undermines the life-saving work of the health district staff. To end the pandemic, we must not just think about our own personal needs, but also our obligation to each other. Since the virus spreads, it's not just about protecting my personal health or my willingness to accept risk. It's about recognizing our patriotic duty and acting to protect others. Please be true leaders and appeal to the best, not the worst, in our fellow Americans. Lead by example. Promote understanding, not anger. Lower the temperature. Urge calm, not outrage. Discord and disarray in our response to the pandemic serves the virus, not the general welfare, as the Constitution put it. There is no such thing as freedom without duty. Remind people of that. Please work with the health district staff and to end the pandemic for a quick restoration of our freedom. Now more than ever, united we stand. If I can be assistance in this effort, please let me know. Thank you, and thank you for your service.
Ryan, I'd like to address that particular letter because Mr. Kaur sent that to me individually in my role as commissioner, and we exchanged emails. A lot of what we're talking about here at Public Health is subjective, and I would say the best way to lower the temperature is to go back to allowing people to choose what's best for them. That is unfortunately why we're in this situation. We have a heightened sense of under threat of freedom here, that we typically had the opportunity to choose what medical practices we were going to follow. We would go to our doctor, we would get prescribed medicine, or we would be told these are the things you can do to try to live a healthier lifestyle for yourself. My conversation with Mr. Kaur through email was that a lot of this continues to be subjective. It is not proven out in court and will be. And I think the best way to lower the temperature is for everyone to acknowledge we all have a personal opportunity to determine what's best for ourselves. And a mandate by one person forcing someone to make a permanent change to their body under the guise of a temporary order is not the way we want to go here in the state or in Washington. So I appreciate his letter, and I do agree the best way to lower the temperature is for everyone to go back to allowing each other to do what we feel is best for ourselves and our personal health. Thank you.
I'm going to ask, please, that we can continue to have the public comment period until that's closed, and then we reserve comments until after that's finished, please. That would be helpful. Appreciate it.
I believe, Andre, that at every point Mr. Ibach has read the letters, he's invited response from the board at any time.
Well, our normal process is to allow for the public comment from the community. And so the idea is that the public comment stands on its own. I welcome any comments that are made, but I'm hoping that we can finish through those and then allow the board to discuss them at any time, as you mentioned.
Thank you for articulating that for the first time this morning.
Okay, I will continue. The next one is from Jean Mendoza. Please ask yourself whether the Yakima Health District Board of Directors is responsive to the public. On July 27, 2021, the Friends of Toppenish Creek submitted comments to the board. An analysis of data from the Washington State Department of Health that showed higher incident and death rate from COVID-19 in the lower valley compared to the upper valley in Washington State. Concerns about poly and perfluoroalkyl substances and biosolids that are applied to cropland in Yakima County. Please add concerns about dioxins and furans. Concerns about a proposed composting area with potential health impacts on neighbors. The Yakima Health District did not respond to our comments, and the Yakima Health District Board of Health has not discussed our documents. Washington is a local state control state. The proper place to voice our concerns is before the people with responsibility to address them at ground level. We respectfully request your attention to these issues that directly impact public health in Yakima County. That is all of the public comments.
Well, I would like to address the letter from Ms. Hauser. I think this has come up several times, and I would like to put into the minutes a couple of links and references. One is a Cochrane review, which is a fairly extensive review of the literature. It was published by Jefferson et al., and it's a review of 67 randomized controlled trials and observational studies on mask use to prevent the spread of disease. That one's from 2011, so it preceded COVID, and thus doesn't have any political bias. Another one is from the Proceedings of the National Academy of Sciences by Howard et al. That's from the University of Texas just this January. And it's titled An Evidence Review of Masks Against COVID-19. And it finds both positive and negative aspects, but has over 140 references. And another good source is the American Academy of Pediatrics, who have a number of pages of information with good scientific references on the limitations and benefits, safety, and every other aspect of mask use in children. Obviously, there won't be a randomized controlled trial for children with COVID. You can't randomize children to either a safe, effective means of protection versus exposure. But I'll put those into the minutes and give those to Victoria to list. With regard to Casey Core, I actually think that letter was spot on and very appropriate. And I know Mr. Anderson had a topic on for the agenda for today with regard to decorum and how our meetings are to be run. And I will try to keep up with Robert's Rules of Order. But if we can allow everyone to finish their presentations, be concise in our questions and statements, and after making them, please yield the floor to additional board members to go give everybody a chance to speak. That would be appreciated.
So Dr. Clary, I'd like to address the third letter, if I may.
Yes.
And while I am not entirely clear of, I read through it and I listened to it again this morning. I'm just inquiring why they have not heard back from the Department of Health, the Health District, or even the Board of Health on. I don't remember reading such a letter. Maybe it was before I was on the Board of Health, or maybe it hasn't come through, but certainly there's a response.
Yeah, I can speak to that a little bit. The composting site that there are some concerns about is going through the initial stages of the application process through, I believe, Yakima County Planning, Land Development, Yakima Health District, and Department of Ecology. We all work in partnership on solid waste facilities like this. And there is a public comment period. We received all the public comments from the county. Our standard process for that is to review these public comments, and also ecology will review those as well. And then next step in the process is reviewing some of the items on the application, and then addressing some of the concerns from public comment. And I believe it should trigger some sort of SEPA to circulate around through all agencies and kind of make a final decision if this is something that can be done or not. So it's still in progress, and those comments are still being reviewed. So that's where we're at with the composting facility.
So thank you, Sean, very much for that. I appreciate knowing that. I'm wondering, apparently they are not aware of the process. So if somebody could just reach out to them, let them know, I think that'd be helpful.
Yeah, I'm happy to reach out to them and update them on where we're at in the process and where we stand in that process as of right now. So
thank you.
And if I may also, oh, I'm sorry, Ryan, after you.
Oh, I'm sorry. Go ahead, Sean.
No, please, after you, sir.
Oh, yeah. Also, to address the lower valley issue, is we're always looking at the data, and when we see hot spots, we do target those areas. Try to get increased messaging, increased testing, increased vaccination sites to those areas. And so we have been aware that the lower valley has been higher throughout this pandemic.
Mm-hmm. And Mayor Byers, I want to say we have a long history in communication working with the Friends of Toppenish Creek. There are times when we receive information where there's a specific request, and there's other times where it's simply an awareness letter. And so we share that information. And so it may be unclear. There's times when Friends of Toppenish Creek shares information that they wish to be conveyed to the Board of Health. but it's not a specific request for an action or a response. And so we can work on clarifying that with them as well.
Thank you, everyone.
Okay, then I think we'll move on to the consent agenda,
Dr.
which is,
Cleary, if I might, I know you had just requested that you have certain links to studies for the masks entered into the meeting minutes. So I would just like to have the following read into the meeting minutes. This is Dr. Anthony Fauci. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with their masks and they keep touching their face, end quote. That is March 8th, 2020, Dr. Anthony Fauci, for the record. Thank you.
okay, so back to the consent agenda. That's within the packet. Can I have a move to accept that, please?
I move to
accept.
approve the
Go ahead,
consent
Molly,
agenda.
I'm sorry, go ahead. I'll second.
Nyla Duval, move to approve the consent agenda. Sorry.
That's okay. Mayor Byer seconding.
All right. Ryan, do we need to have a roll call or can we just do any opposed?
Yeah, we can do, I believe we can go ahead and ask for any opposed. Approved or
Any,
opposed.
okay, any opposed? None opposed, the consent agenda is accepted. We'll move on to board business. Mr. Fresco.
Morning, Dr. Cleary. Thank you for being here. Good morning to the board and to the community. Thank you, Dr. Cleary, first off, for chairing the meeting in Commissioner Anderson's absence. I appreciate it. I wanted to talk overall about where we're at with COVID-19. A lot has happened in the last 4 weeks. I would never have imagined that during summertime we would have the increase, the dramatic increase in cases and hospitalizations and deaths that we have had. So I wanted to share what we're doing to prepare for what we think will be a difficult fall, and also communicate, and you'll hear this communicated through other people's presentations as well, because it's important, I guess, to share that while we're hoping that this wave is in fact a wave and reduces, we are always planning for the contingencies that come with making sure that our community is safe. So I want to thank the board again for supporting an increase to our budget. Having an amended budget allows us to have more flow of available funds that lives within the budget that is supported by the board and approved by the board. So thank you for allowing that to happen. That's permitting us to have a window of opportunity to respond to the needs of this community. And you will also hear, I'm not trying to steal the benefit from Chase, and Chase will go into more detail, but we have been approved for increased Fema funding, which allows us to continue vaccine response. And we are needing that because, as you may very well know, there is an approval process happening for a third shot, or a booster shot as it is being called. Currently, it's being discussed for Pfizer. We expect that to happen for Moderna, and at some point eventually that may also happen for Johnson & Johnson. So the idea of having more shots available means the need for increased vaccine opportunities. And so we're going to work with our colleagues, obviously, in medicine, hospitals, clinics, and so forth. But the idea is that we're preparing for the fall. We're prepping our staff for an increased workload. You'll hear about schools. There's a lot of strong feelings around that, but we are going to have schools in person, in session very soon. And so we're prepping our staff for an increase as well. We're also prepping for something, and I want to share this with you now because, again, in our work and being a response-ready organization, we're planning 6 weeks out, 3 months out, 6 months out. And part of that is the reality that we have a dramatic spread currently in our community And this is summertime and people are outside. We're also prepping for the fall when people will be going more indoors. And there are a few things that are unique in this situation that I want to address. While this may be considered a wave, I'm thinking of this as a whole new initiative. We have a dramatic spread, and I think you'll hear from certainly Dr. Barg about the uniqueness of this Delta variant, but it's more easily transmitted. And one of the concerns about that is that the more transmission you have, the more unsafe your community is. The reality is that we have to prep for something that we haven't had before, which is a very large increase in community spread at the same time that schools are opening. And we have to prepare for the inevitable flu and cold season. We had almost a non-existent flu and cold season last year, but we also had people working far more remotely. We had people distancing. We certainly had more mask use. We simply didn't have a lot of that spread. Now, I'm not saying that that's going to happen, but we anticipate that in a normal year in cold weather, you're going to have flu and cold. And that coupled with certainly with coronavirus could be very concerning in terms of support for our hospitals, but also the safety and welfare of our community. I was hoping to ask Jocelyn, if you will, to pull up that slide that I shared, please. I wanted to share a slide that was shared with us from the Department of Health. It's from the Centers for Disease Control, and it has information about what's happening around the country. And I wanted to share that. Jocelyn, I don't believe it's up yet. Thank you so much. So this is from the CDC, and the period is from the 12th of this month through the 18th. And I wanted to show it with you. At the bottom, you'll see that there's a chart for transmission spread. We have low transmission in blue, moderate yellow, orange for substantial, and high for red. We are looking at the United States here, and it's a very dramatic slide. I share this with you because it just stopped me in my tracks. Our focus obviously is on what's happening in Yakima County with an awareness of what's happening in the rest of the state and the region. But this is a dramatic slide for me. This indicates that the spread of coronavirus is intense around the country. And this is a reality that what we're dealing with in Yakima County is happening throughout the country and impacts us as people do a lot of traveling during the summer. This will inevitably have impacts for our community, and that's something that we're seeing. And I wanted to share that the situation is stark, it's serious, and it's deadly. We have full emergency rooms. We have hospitals that have all their staff working around the clock to keep people safe. There are issues with ambulance transport. It is a very serious circumstance, and we have people getting sick. And so you'll hear that throughout our presentations. What I'm trying to convey to you is that this is serious. And for those who are concerned about the idea of choices being compromised, I would share that part of what's important in our society is the idea not just of independence, making independent choices, but the reality of being interdependent. Interdependence is what we have here. The choices that each of us make determine the health of our neighbors, of the people that we work with, of strangers that we pass at the store. And that's why I want to focus on interdependence. We're all interdependent in a community, and the choices that we collectively make have impacts for all of our health. So I'm going to be asking the board to consider that while we may have differences, while we may have concerns, while there may be things that we don't like and we have to compromise on, the reality is that this community is unsafe currently. And we're trying to make certain that every person comes through this healthy and well. And part of that is continuing to press for people to become vaccinated. We have the benefit of drugs like Pfizer no longer on an emergency use authorization. The idea that it is now a stable, approved vaccine, I think will be helpful for those who are on the fence. But I'm asking the board to consider that we as a group, not just the board, but the board and the staff working in unison, have a responsibility to continue to make this community safe and work through difficulties, because I anticipate that these concerns will continue well into the fall and winter. Happy to answer.
Andre, question for you.
Yes, sir.
Well, the map is stark, but I mean, what stands out the most to me is Nebraska. Nebraska seems to be, I don't know, 80% blue, whereas the rest of the nation is red. Could you comment on what Nebraska is doing that the rest of the nation is not?
No, I've asked many colleagues that very specific question, and I really don't have an answer. It was surprising to me as well. We're continuing to try to work with colleagues around the country to find that answer out, but I just don't have an answer. I wish I did.
I'll just comment that if you look north of it in North Dakota, South Dakota, and North Dakota, this was something that was predicted months ago, is that the entire population has been exposed. At one point in South Dakota, it was thought that about 90% of the population had already fell ill to COVID or at least been exposed asymptomatically, and thus they are protected. And that seems to be now borne out that they are not spreading the disease because they've either been vaccinated or they've already had the infection.
Dr. Cleary, so if I'm understanding you, you're stating that there were enough people who were exposed initially to the initial variant who achieved naturally acquired immunity, and therefore now that the Delta variant has come through their area, that they have not contracted and spread it as quickly as those people who had not yet contracted it naturally?
That's the presumption. The prediction back in April was that they would be the first state to achieve herd immunity by natural exposure.
But just to be
Thank you.
clear, that we don't know how long the natural immunity lasts for, which looking back at for Yakima County, we are currently in our 4th wave instead of our 5th because we had such high numbers initially, but now we're catching up with the rest of the United States and reflecting what everyone else is doing.
Thank you for that point, Melissa. Do we know for sure then how long vaccine immunity lasts?
Because Dr. Barr, looks like you want to say something.
Yeah, so natural immunity is not as high as vaccine immunity. That is to say, you have more effective antibodies after a vaccine than you do with natural infection. They are recommending that people with natural infection get immunized as well so that they have more potent and longer lasting immunity. The people who are exposed to Delta virus that have had alpha virus, which is the first strain, can still harbor the virus and spread it. And that's what happened in the outbreak in Provincetown. Many people who were asymptomatic and vaccinated were transmitting the virus without knowing it because for some reason Delta is able to do that where alpha wasn't. So if these people from South or North Dakota go elsewhere, they could be spreading Delta virus once they're exposed to it and not be sick at all.
Dr. Barg, so based off what you just said, let me clarify though. Did you also state that vaccinated people can carry COVID and spread COVID?
That's the Delta virus. They definitely can.
Yes, that's one of our, thank you for bringing that up, Commissioner McKinney. That's one of our concerns is that even though you may be vaccinated, and even though you may be asymptomatic, you may be a carrier of a contagious disease that can be spread to others. So again, in the concept of interdependence, we all have a responsibility to make choices to make certain that people are safe. It is a dangerous time to think that you can be vaccinated and still actually spread it to others. The beauty of vaccination is that if you're vaccinated, the likelihood of hospitalization, severe illness, and death is far lower. So those who are vaccinated are actually safer than those who aren't. But I think we all have a responsibility to care for every person in our community, especially those who are unvaccinated, because they are the most vulnerable. They are the ones who are least likely to get through COVID without some serious change to their lifestyle and possibly to their long-term health. So that's why we're so concerned. And it's a serious issue in a county that doesn't have as high a vaccination rate as I think we all would have hoped. So that's why we are so concerned about moving into September, October, November.
If I might amplify that, we don't know who's infected if they're asymptomatic, and we don't know which vaccinated patients are carrying virus and spreading it. So that's why we have to do something for as many people as possible to deal with this outbreak.
So if we know that the people though who had the opportunity to get vaccinated have had the opportunity, and now we know that people with natural immunity can still spread COVID, and those who are vaccinated can still spread COVID. The whole point was to slow the spread to get to the point where those who chose to have a vaccine for protection against severe symptoms had that opportunity. So if we know this is a virus that's going to continue to spread, and your comment, Director Fresco, was that the community is unsafe and that we need to make it safe. So how do we make it safe? What does making it safe look like?
Well, in a
We're
perfect
not going to
world-
be able to keep it from spreading, and people have had the opportunity to have the vaccine. Can you articulate what a safe community looks like as it pertains to COVID?
Certainly, a safer community is more people being receptive to vaccines and taking vaccines that can save their life, that can save the life of their immediate family. We know that many families are united in their stance on vaccines. So often, if someone lives in a family of someone who's unvaccinated, often the entire family is unvaccinated. That puts that entire family in jeopardy. So that is first and foremost one of the ways that people can certainly become safer, is to become vaccinated. That's important because, again, we don't want people to suffer a loss of a loved one. It's a tragedy. We don't want people to be hospitalized. And also, there's a financial and emotional impact to somebody being sick and not being able to work. That has a tremendous impact on our entire community. Also, the idea of making choices, informed choices, to ensure that you don't spend time with people in circumstances where you may spread it is important. We'll certainly be talking about masking, I'm sure, today, but masking is another option. Distancing when you're in large group gatherings at the store and so forth. Choosing not to spend time in crowded areas, staying home if you're sick, if you feel that you may have COVID, getting tested. These are all options that we have to avoid the spread of this disease. And again, if we think about ourselves as caring for others, strangers, people close to us, people we work with, I think it's our responsibility as citizens in this community to do all we can to improve the safety of our community.
Well spoken, Director Fresco, and I think we all want a safe community. That's why we're here. But you didn't answer my question. What does safe look like? When have we achieved creating a safe community?
Well, I thought I answered your question. The idea of having more people vaccinated creates more safety. More people wearing masks will reduce the transmission of the disease. Ensuring that people make informed choices so that if they're sick, they stay home. Making certain that if there is an activity that you wish to be part of, but there's a chance of staying home and remaining safe, I think those are all the things that we have to do. And while this may come as a surprise to people, it's certainly, we have a fatigued community. We have people who are tired of having to make compromises. I recognize that. But we are by no means in a safe circumstance because the numbers are dramatic. We don't have as many people vaccinated as would create the kinds of safety that we're talking about. And we have to prep for a tough fall.
So are you articulating those things as permanent changes in lifestyle?
I don't know what you mean.
Well, I'm asking you, the things that you're describing, masking, social distancing, changing our behaviors, choosing to get vaccinated, those are decisions that you're recommending that we do to create a safe community to achieve. But when have we achieved safety to not mask and social distance and make these decisions? So
I can answer that.
vaccinate.
Well, I think I can't predict that, first off, but I will tell you that if we weren't having this spread, I would feel more comfortable with people not wearing masks. If we did not have dramatic spread of COVID in our community, maybe the idea of a certain percentage of people not getting vaccinated would be okay. But these statistics don't lie. We have dramatic spread in our community. We're not safe yet. And so we have to continue to compromise. And that is going to be tough for people. And I don't have an answer for how long that is. But I think that it was premature for people to say that COVID was over in June or July. We do not have it over by any means. And I'm being very honest and direct with the community and certainly with our board about the reality that I anticipate it being a tough fall and tough winter. It is harder, I think, in enclosed spaces when it's cold. It's harder when people are indoors, I think, because the spread is more pronounced. I think that we are going to have this for a long time.
I think
Well,
it's,
always thought- I have one more, Dr. Cleary.
I think you, Ms. McKinney, could you please yield the floor to the other board members, please?
Sure, I'll follow up afterwards.
Okay, so if you look at the map, you can also see that there is a lower rate of transmission in the Northeast. And I think they've achieved safe communities by the fact that, at least in New Hampshire, they have a 90% vaccination rate. And so my idea of safety would be that if we had everybody or a very large portion of the community already vaccinated, then there would not be a concern about the vaccinated carrying virus and spreading it to someone who's susceptible, because we're still seeing that the hospitalizations, the deaths that are occurring now are in the unvaccinated. And so we're trying to create a safe community by protecting them until they can get vaccinated or unfortunately develop immunity by having been exposed. I think the former would be the better way to go.
If I could amplify that, Sean.
Yes.
Safe is when people aren't getting hospitalized, being intubated and dying. And we had a situation like that in June and July where there were 2 patients in the hospital and nobody on ventilators and no deaths. But that was with the Alpha strain. Delta's a new ball game, and it's almost like having a new pandemic.
Commissioner McKinney, did you have an additional statement?
Yes, if no one else wants to go, I just, I guess it still comes down to, so what you just articulated, Dr. Barg, is that 2. And so again, if the whole point was to slow the spread to get to a vaccine that people could choose to get for extra protection, now it seems like we've changed the goal. And now the goal is we're only safe if everyone gets vaccinated, or I'm hearing the majority. I've heard 80%. Now I've started to hear 90%. And then our governor has articulated 100%. So Dr. Barg or Director Fresco, is there any kind of sense for what now is the new number of people that need to get vaccinated for us to be, quote, safe?
I think it's the wrong perspective to look at this as this idea that if we achieve a certain level, we're safe. I think the idea is to accept that we have to be adaptive. COVID is adaptive. It's an adapting virus that is seeking a host. It is changing so that it can achieve what it's looking to achieve. And so we have to be responsive to that. So again, I'm sorry that this is difficult for people. I know that this is a strong compromise that we're asking of people, but the reality is that we have to be adaptive to the needs of keeping this entire community safe. Currently, the dramatic spread that we're seeing and the loss of life and hospitalization is a preventable tragedy, because we do have this vaccine that could keep more people safe. And so if we have more people getting vaccinated, my hope is that we will have less transmission. I would never say there's a certain number, but the idea of every person being vaccinated would please me dramatically, because I think the people who are most vulnerable now are those who are not vaccinated. And also many people who are not vaccinated also do not wish to mask. And so they are causing the potential for their families to be hurt economically, themselves to be hospitalized, certainly having long-term health effects that will be dramatic for this country. This is all preventable.
All for them.
Well, it's actually, as I said before, it's interdependent. It's all for us as a community. I do not want to live in a community where people are throwaway citizens. I want to make certain that every person is safe in this community, whether I agree with them or disagree with them, whether they like me or dislike me. My hope is that they remain safe. And our focus now is actually on those who are most vulnerable, and those are people who are unvaccinated.
Commissioner Fresco, I guess I would just ask that the mutations that are going on in the virus are going to continue to go. I'm a little bit hesitant to use the term booster shot, when in reality, these vaccines are going to need to be modified to be entirely new vaccines as time goes by. So really, you're talking about an annual or semi-annual or some periodic new vaccination to try and stay in front of the mutations of the virus. I'm wondering if Dr. Bard could comment on Lambda and or its oncoming versions that might be entirely resistant to vaccines as we have them, and what are the plans for that? Because what I see is us chasing our tail against a mutating virus that frankly is going to have to run its way through our communities, our nation, and our world until such time that it either burns itself out or it infects everybody and you have natural immunity, but you're still going to have smoldering pockets of disease. So I yield to Dr. Bard to maybe comment on that.
So, Dr. Atterbury, there is going to be movement in the virus, which changes the effect of the vaccine. There is a different effect of the vaccine, for instance, on Delta, but importantly, even if you're exposed and vaccinated, you do not get that sick. Very few people are dying that have been vaccinated. It's a very small percentage. There are breakthroughs. Most of those breakthroughs are fine. They don't have to be hospitalized. Some are, but again, the numbers are quite small. The vaccine technology itself can be modified. So you take the basic protein structure of the most important part of the virus, which is the spike protein, and it can be sequenced quickly. The current strain has been sequenced, the previous strain has been sequenced, and through modeling, they can determine how to make the mRNA molecule make the spike protein with the modified structure. So the vaccine can change as the coronavirus particles change. The other thing is, as more and more people are either vaccinated or exposed to the virus, this will become the fifth of the 4 current endemic coronaviruses, which just basically cause colds, and you might miss a day of work. And how long that's going to take, nobody knows, but it's probably in the terms of years, and then it won't be a problem anymore if we're all lucky.
And Dr. Atterbury, I'd like to respond to one thing you said about letting it run its course. That's not something that we could control. So one of the reasons that the vaccine is a great solution is that it reduces dramatically the potential for death or hospitalization. That also allows us to do the things that this board was very concerned about 8 months ago, a year ago, which was a functioning economy. If people become dramatically ill, we will not be able to have businesses run as well as they would otherwise if people were healthy. That's an impact to our financial bottom line in this county. If we have hospitals that are inundated with patients because they're sick with COVID, that means that other patients with other illnesses cannot be cared for. That was another concern that this board had a year ago, which was, what do we do for all the people who have other illnesses that are compounding? The mental well-being of our community is important to us. And I think that as people become sick and miss work and they're fearful that they might be infecting their family members or their friends, or possibly being hospitalized, that has a dramatic impact on the mental health and well-being of our community. And I want to share with you also, in no uncertain terms, that this is summer. It's pretty outside, save for the occasional smoke-filled day. We have serious circumstances in this community, but we are not on lockdown. And I am sharing with you that if this gets worse, and if we have more dramatic death, and if our hospitals are impacted, there could be more restrictions. And so we're trying to avoid that at all costs. One of the alternatives is that everyone in this community does everything in their power to keep themselves, their family, and their community members safe.
Yeah, I wanted to just reiterate, I'm 100% pro-vaccine, vaccinated myself and my entire family, including my children who just barely qualify by age. So I would reiterate what everybody is saying and what Dr. Barg iterated, and that is, with vaccination less severe disease, less death, less hospitalization. So I am not, and I want to make sure I sound this off, I am not anti-vaccination in any way. I'm just suggesting that it seems to be a moving target. And so we're going to have to keep evolving our vaccine, if you will, to stay in front of our pandemic, which doesn't seem to want to go away. And just like other coronaviruses, likely isn't going to go away.
Yes, sir. Thank you for that.
And I think it would be good to add to your point, Dr. Fresco, or Director Fresco, rather, that I was on a call yesterday with Dr. Lindquist, where he did let the group know that he was daily advocating to the governor for a complete shutdown of the state. He's advocating for no large events, no gatherings. So to your point, what you are discussing in meetings with the Department of Health certainly is more severe shutdowns under I guess, until we can get through the weeds of this mandated vaccine for those who've thus far chosen not to receive it.
Dr. Cleary, that's all for me, unless there are further questions that I can answer for the board now or in the future of the meeting.
Okay, then we'll move on to the financial report. Mr. Porter.
Good morning. I would just like to quickly say that I have spent a lot of time in Nebraska, and it's a very Republican state. And as a Cornhusker fan, I don't know if you can see this, 97 champions. Our mantra is "Go Big Red." So for it to be painted blue is very unnatural. I don't think it's very strange. So I just had to say how ironic that is that Nebraska is painted blue. Moving down into the financial statements, please. Thank you. Starting at page 18 in our agenda. One more down, please. So we had a gain of approximately $57,000 for the month, bringing our net excess revenue to $22,000. I wanted to point out the prior period adjustment of about an $11,000 loss. We have grants ending, contracts ending at the end of June, and those periods stay open until mid-August for any final billing to come in. So our development disability program ended, contract, I guess, for that period ended, as well as our BCCHP. And that stands for breast cancer, breast, cervical, and colon health program. I almost got it right. I've been here almost 5 years, and I butcher that every time. So we worked with Department of Health, and they are actually going to allocate us an additional funding from that. We saw an additional need within the community, and we talked, Lillian specifically talked to the Department of Health, and we were able to divert some funds that would have normally gone to King County. So that's some support from our partners, sending funding our way. Moving down into the budget piece of this. Sorry, I'm still talking about the summary. I'm sorry. I just wanted to point out that the revenue expenditure budgeted piece on the summary right here is the original adopted budget. It is not our amended budget. I like it like this way, just to see how much I went over by the original. I can show you a little bit further into the report where we have the amended. Any questions about this piece so far?
Chase, Jocelyn, if you don't mind, can we make the screen a little, or rather the font size a little larger?
Thank you.
So they can read.
And
it.
I'm sorry, Andre reminded me just now. I got excited about Nebraska, and so I forgot to mention the FEMA funding. The FEMA was extended until the year end, which is incredibly important. And this, with the board-approved budget addition of $7 million, and the FEMA funding is more or less bottomless. As long as we're working on vaccine operations, we can use as much money, FEMA money, as we need to. So with our budgeting, our budget's there and the funding's there. So if there's a need to move for vaccination operations, if we need to increase that, those two critical pieces are already set up. So I just wanted to point that out. Thank you, Andre. Moving down into the next income statement, I really don't have a lot to point out here. It's been a normal COVID month as we spent a lot of federal money fighting COVID. The Over on the far right column, the year end, 5 months remaining. The expense is where where I've updated the new budget. I didn't hit that with tickers. I will for sure next month. Will you move down into the next page, please?
Can everyone read that screen or should we make it larger?
Please.
Okay, I'm sorry, Jocelyn, if we
I
could make.
printed
just
it
a bit
out
bigger.
this time. My eyes are getting bad.
Well, I'm the first to admit that I'm squinting. Is that okay for everyone, or should we make it, can we make it just a bit larger? I'm so sorry. I don't know if it'll fit.
Yeah, just go up to 100.
Thank you so much, Jocelyn.
Yeah, and then scroll to the right. Thank you. So the 5 months remaining, we got 5 months left. And then Jocelyn, will you move to the next page, please? So I would like to point out here over on the far right, the 2021, this is where we're showing the amended budget of 14.5 million. So with our 5 months remaining, we have approximately $8 million left in budgeting. So we have lots of room to operate up until the year end. The budget's there, the funding is there. So if we need to move and do some sort of mass or pivot in a certain direction, we are set to do that financially speaking. Any questions? I kind of went through that quickly.
On
All right,
so those use of funds, Chase.
I'm sorry?
So the use of funds, so it's anything. So we could potentially use it to, if we wanted to help our hospital system and bring in, outside nursing staff or people who can help with treatments for people who've contracted COVID, or is this strictly for preventative, like PPE?
Yeah, this FEMA funding is strictly for vaccine operations.
Thank you.
Thank you. Next page into the programs. I don't have a lot to note here again either. It's kind of hard with this scrolled all the way in to point out anything specific. Nothing necessarily specific. And will you scroll down slightly, Jocelyn? This is our EH programs. And one more down, Jocelyn. And this is wrapping up our final. I just like to point out our vital records had a bit of an uptick this month. And so we're back into the black with that. There's a lot of people looking for birth certificates as we're gearing up for school. Excellent. Please move into the COVID income statement. This is our COVID expenses for the month of July, and then our annual piece. And if you scroll right down, so we've spent almost $4 million on COVID throughout fighting COVID this year, just through July. And then final presentation slides, please. And like I said last month, we always expect an uptick in cash. In July, we receive $1 million each year in flexible dollars. That's allocated to us by state shared revenue. We receive that money in January and July. So I'm always expecting an uptick in January and July cash, and then we'll start to maybe tick down a little bit as we spend those funds out. Any questions regarding the financial report? Thank you.
Okay, can we have a motion to accept the financial report?
Yes, this is Commissioner Lindy, move to approve.
Mayor Byers, second.
Any opposed? And the motion passes to accept the report. And can we move on to department reports, Mr. Ibach?
Okay, so we continue to work with these schools, the school districts in schools coming, or children coming back to the school for in-person learning. Starting this school year, that everyone will be in person 100%. There are 3 feet of social distancing that's required. However, that is not, that 3 feet, if you can't meet the 3 feet, should not be a deterrent to have everyone back in full in-person learning. So schools are trying to keep that 3 feet distancing as much as possible. We have worked with, we met with the Yakima School District COVID outbreak response team yesterday. There are concerns. School starts today is the first day, but this week they did report 13 staff and 9 students that were in person while infectious. So there is concern about staffing shortages at the school districts. And so we'll continue to work with school districts, superintendents, principals, to try to keep it as a safe environment, low risk as possible. We do have two positions that we have recently filled at the Yakima Health District. We have an accounting tech position that was filled, and an HR payroll procurement specialist position that was recently filled. So it'll be nice to have that extra support at the Yakima Health District. And then the last thing that I have is we are starting to plan our budget for the year 2022. And so I will be sending the board members a schedule of the budget and the activities that will be happening. But just to go over it real quickly, on the next meeting, September 8th, we will be submitting any proposed fee changes to the board. At this point, we don't anticipate any changes in fees. We will be advertising on September 8th, or advertising the public of our fee schedule, so that we can on September 29th have a fee hearing and then the adoption of our fees for the year 2022 by the Board of Health. On September 15th, we will have a budget planning session to discuss our preliminary budget. Also on the meeting at the end of September, we will be introducing the draft budget to the board. And then we will start to advertise our budget on October 1st to the public, so they can see the budget and comment on anything that they have, any comments they have on the budget. Then at the end of October meeting, Wednesday, October 27th, at the Board of Health meeting, there'll be a budget hearing and then a possible adoption of the budget. Usually we don't have a meeting in November due to the holidays. We combine November and December's regular meeting into one meeting at the beginning of December. So at this point, we don't have a meeting planned for November unless needed. And then if the budget does not pass at the end of October, then usually that beginning of December, so the December 1st meeting, the budget would be up for adoption again if it doesn't get passed at the end of October. Again, there's a lot of information, so I will be sending you the schedule out to everyone so they can follow along. And that's all I have. Is there any questions?
I just wanted to thank you for giving us a heads up on the dates, because I noticed in getting our packet that it says upcoming Board of Health meeting. The next one is September 29th and then followed by October 27th. So apparently the change that we made in our schedule to have at least 2 meetings a month is not yet reflected in what's going out. So hope to get that changed. Thanks.
Yep.
I had a couple questions, Ryan, regarding schools.
Yeah.
So one question I had is, I'm understanding that when we're talking about cohorting and potential exposure, that we of course have vaccinated and unvaccinated students, particularly in the high school setting, let's say, and that the vaccination status is something that will remain confidential. But my understanding is that if there's a cohort that's been exposed to COVID, that the unvaccinated students will be sent home and will have to quarantine, but that the vaccinated students will not have to. So my question is, what is the logic in not sending everyone home, since we now know that if you're vaccinated, you can still contract and spread COVID? And then how is that protecting the medical, confidential medical information? Because it will obviously be obvious that the students who were sent home were the unvaccinated students, whereas the ones who were not required to quarantine will still be in the school setting. So I'm just curious about that situation and what the logic, and then how are we protecting the private medical information for those students? Yeah,
you are correct that if there is a close contact with a vaccinated student and they're not symptomatic, then they don't have to quarantine. If you're not vaccinated, then you do. I don't know if Melissa or Dr. Bard want to go more into the details on maybe the logic behind that.
So initially, when the CDC came out with this guidance, it was when the efficacy of the vaccine was much greater because we didn't have the Delta variant. They may start looking at that and advising quarantine for everyone. I don't know. It's nothing that's been talked about that I've known about anyway, but they have now changed where they recommend that you don't have to quarantine if you're vaccinated, but that you should get tested.
Okay, so that might change, and we are then not protecting the confidential medical information of these teenagers.
So in public health, you do the best that you can to protect the confidentiality and HIPAA. But at certain points, if it is needing to protect the health of the community, then you do. So the nurses are not going to say so-and-so doesn't have to go home because they're vaccinated. You know, it can be assumed that those children are vaccinated if they come to class, but it's nothing that's going to be just shared openly with any other students.
Well, I think the empty seat the following day will speak volumes to who's been vaccinated and who hasn't been vaccinated. Our teenagers in high school are quite smart. Okay, so that answers that question. The other question I had then, Ryan, what is the discussion that's been shared with you when you meet with the superintendents regarding their concern for staffing shortages due to the mandate for teachers that came out? My understanding is that there's anywhere between 30 and 40 to 45% of certain school districts where the teachers and staff did not initially attest to being vaccinated. So have they shared with you any information about that massive part of our population within the school districts in Yakima that are not vaccinated yet?
Yeah, it just came out, that information just come out just before the superintendent meeting last week. And so there was concern about staffing. At that point, there wasn't necessarily the numbers of how many vaccinated staff they had or not. There's a lot of discussion on exemptions, a lot of discussion on continuity of operations. How are we going to plan for the future in case we do have short staff, whether it's one due to staff getting COVID or two if there's staff that decide to quit for the various reasons. So they are in the planning stages. There is concern across the board on staffing shortages for multiple reasons. I hope that answers your question.
It does. Thank you.
And I'll second that. I was on a meeting yesterday with Yakima School District with Ryan as well. And the concern isn't so much staffing quitting, it's a concern all across the board. They're worried that because our numbers are so high that they're going to have staffing shortages due to people being out for quarantine or having COVID and having to isolate.
Commissioner
As
Lindy,
well as contact tracing and how they're going to keep up with all of that.
pardon me, Commissioner Lindy, did you have a question, sir?
Oh, just a comment that in my former life, I was, among other things, the HIPAA privacy officer at the hospital. And I can tell you from a privacy standpoint that there is a carve out or an exemption for public health interest in the HIPAA regulations.
Thank you.
Thank you, sir.
A question for either Melissa or Ryan. So just so I'm clear, the mandate for all healthcare workers to be vaccinated to work in healthcare, that's not applying to teachers. It would seem logical that public health exposure in certain risk groups like healthcare workers or school teachers would be about the same or maybe a little higher, I guess, in healthcare workers. But nonetheless, is there not a mandate currently for teachers for vaccination for their?
There is. It came out shortly after the one for healthcare workers, and the date is still the same, October 18th, for teachers and any, including volunteers and potentially even school board members. The school board members are left up to the policy with that district, but
So
volunteers.
Anybody who works at a school then, or tied to a school in any way, contractor, et cetera, will be vaccinated.
Exactly.
Bringing that up, Melissa, that was something that that I think a lot of people still don't understand too. In order to volunteer in your child's classroom, you will have to provide proof of vaccination. To serve on a school board, you will have to provide proof of vaccination. So it is certainly interesting how, in order to continue with social norms, we're placing these requirements for someone to get a vaccine. But as Director Fresco said, it's all for them.
No, ma'am, it's actually all for us.
Oh, maybe you misspoke the first time.
No, I meant that I'm concerned for the safety of those who are unvaccinated, but my overall concern is for the entire community, which includes all of us.
Any other questions for me before we move on? Thank you.
Thank you. Mr. Johnson?
All right, good morning, everybody. So a couple things, one of which is with the increase in COVID and also the increased demand on the Yakima test site. We have been able to work in partnership with, again, University of Washington Lab and Columbia Safety to bring back a test site for the Lower Valley. It will be at the community center, and the first day of operation is actually today. It will operate Sunday through Thursdays from 9 to 3 p.m. Instead of a drive-through, it will be a walk-up. So there will be an area for people to park and then walk up to a test trailer. And again, very similar concept that University of Washington Lab will be helping out with the funding and management of this site through the end of the year.
Is that a rapid molecular test or a PCR test?
It's still a PCR test. Yep. As far as vaccine teams, they continue to go forth. We have, again, 2 teams currently. The FEMA funds are definitely good news, especially as we look towards the booster or additional dose upcoming. As Andre mentioned, Pfizer did get full approval through the FDA, Food Drug Administration, and also the Advisory Committee of Immunization Practices. So that's helpful. And then also a booster dose or additional dose for immunocompromised has been approved through those 2 organizations as well. For Pfizer, anyone with immunocompromised who are 12 years and older, and Moderna, it's 18 and older. As far as an additional dose for the general public, there's been a lot of talk on it. Nothing has been formally approved. We are anticipating that approval to come as early as within the next month. So we're definitely, like Andre always says, is we're looking at what 6 weeks and a month, or 6 weeks and 6 months out looks like. So we're working with our vaccine teams to be able to flex up as needed to ensure that everyone has opportunity to receive that extra dose, and certainly looking at different options of mobile teams and also a drive-through scenario as well in the future. I think that is all on my end, unless there's any questions.
Yes, this is Nyla Duval, and I have some questions for you about the testing. I know that the transmission rate right now is very high. It's over 700. And my concern is that there isn't testing sites, community testing sites that are open over the whole weekend. I think that's when people have the best opportunity to go get tested, especially Fridays, Saturdays. I know that today they are starting on Sundays, but I think that we should, especially for the transmission rate that we have right now, what type of efforts are we doing to have testing sites, accessible testing sites in our communities?
Yeah, great question. So traditionally, our Yakima site has always operated, back when we had both sites operating at the same time, the Yakima site would operate Tuesday through Saturday. So it'd be open on Friday and Saturday. Then the Sunnyside site would be open Sunday through Thursday. So we would always have at least one site open one day of the week or weekend. And as we move forward on bringing back these sites, that's certainly the goal, as well as to ensure that we have test sites that are, again, when we say accessible, it means also the hours and days line up for the community to be able to utilize. So we're working on the Yakima site to be reflect those hours that they have in the past, and then also the Sunnyside site, again, being open on Sundays.
Okay, and then can you speak a little bit about, I guess, the responsibility of the people that do get tested at these other locations? I know that on the health district website, it does say to check ahead of time to see what the financial responsibility will be. for people that don't have insurance, or their insurance might not even be accepted there. Do you know how much it costs?
Yeah, so through our community-based test sites, there is no cost, never has been any cost out of pocket. Insurance information is certainly asked as a way for recovering some of those costs, but if someone doesn't have insurance or has insurance and just doesn't have their information with them, there will be no out-of-pocket cost to that patient.
And Ms. Duval, I'd like to also reiterate that at private providers, clinics and so forth, the expectation is that that patient will still receive the care. One of the reasons that we felt strongly about having a freestanding testing location was to avoid the concerns that people have around requests for money or insurance.
I just wanted to quickly add, sometimes community members also confuse the PCR test with the rapid test, and with the PCR test, those are of course going to be free at every location, as well as some of these clinics may have provider visit fees. And so again, we just encourage everyone, if you're not going to the community-based testing site, to call ahead to make sure that you know exactly what is going to be asked for at that site.
And Nolly, I believe most private clinics are charging between $65 and $100 if you can pay. If you can't pay, it's free.
Between $65 and $100 for what?
For a test.
For the test.
Oh, you're kidding.
I just have more of a practical question for you, Nathan, regarding the dashboard. So when we update the booster shots, so will we be then seeing an update on the category that's considered fully vaccinated? So are fully vaccinated going to then be only those who then received the third shot, or in the case of the Johnson & Johnson, the second shot? So how are we going to consider people going forward when the boosters are made formal recommendations that someone's considered, quote, fully vaccinated?
Yeah, absolutely. So those dashboards are developed and maintained through the State Department of Health, and they typically follow whatever ACIP's recommendations are for those definitions. So following the approval, if the ACIP's recommendation is that 3 doses equals fully vaccinated, then I'm sure that that's what they will be using. But until we see that formal recommendation come through, I can't speak to exactly what it'll look like.
Thank you.
Okay, we'll move on to the health officer report. Dr. Bard.
Good morning. I'm very privileged to be able to talk to the board today and participate in our county health. I'm going to try and inform everyone just what's going on. A lot of the things that I'm going to say have already been said before, but I want to work backwards here for a second. Let's start where the most noticeable issues are, and that's in the hospital. It's full between COVID patients and non-COVID patients, and about 40 patients have been present every day for the last few days, and there's new admits every day. The ER is basically overwhelmed. There's people in the hallways, there's people in the waiting room. Sometimes it takes 3 to 4 hours for any patient to be seen there due to the fact that the system's overstretched right now. All of the patients that are in the hospital with COVID have been tested positive and have appropriate symptoms and laboratory tests that support the diagnosis. Some of them are receiving the latest treatments when they qualify for them based on their clinical symptoms. One of the problems is it's not just our hospital, it's all the hospitals in the state. There are days in the last month where there are no available beds in the entire state to transfer a patient to. Some areas like Tri-Cities have had to transfer patients over 600 miles away. We've had patients we've been unable to transfer as well. Eventually a bed opens up, but it could be 3 or 4 days. And mostly we're transferring to Seattle, some to Spokane. So how did we get there? It's almost overwhelmingly due to Delta virus. One of the reasons that Delta virus has caused this problem, it spreads a lot faster. And for every person infected with Delta virus, many more people get secondarily infected, much more, say, than Alpha, which was the first virus that caused the outbreak. So when it spreads faster, there's more exposures. So what we need to do is prevent exposures. I want to interject here a little bit about disease and a little bit about treatment, which Dr. Cleary and Dr. Atterbury will understand very well. So disease has a continuum. It's not all or none. Some people are asymptomatic. Some people die from any disease that we talk about. There's also a continuum of intervention. So people that are vaccinated may be fully protected and they may be minimally protected. We like the fact that the current vaccine, the fully protected folks are a big bubble and the minimally protected folks are a small little part of everyone that's get vaccinated. So how do we prevent exposures, which leads eventually to disease? We have to back up one more step. The vaccine is the best tool we have. And to answer or amplify Dr. or Ms. McKinney's view of things, she's right. The vaccine works, but it doesn't work on everybody. And as we increase the number of people that are vaccinated, we decrease the risk. There is no specific point that we can achieve perfection. It's just the more, the better. The second way that we can decrease exposures is by going to the source. The source is the people who are infected. I might add right now, when the Delta virus infects a vaccinated patient, not all of those vaccinated patients spread additional virus, only a few do. So the next thing we have for source control is the mask. The article that was cited by Dr. Cleary has an extensive amount of information in it. And basically they come to the conclusion that masks put on a source control person are very effective at preventing spread. They don't let the droplets with the virus out into the air. They're trapped in the mask. The virus does not exist by itself. It's inside droplets that are big enough to be trapped by the mask. So masking does prevent spread by preventing egress from the patients who are infected, the people who are infected. If everyone wears a mask, so universal masking, any potential person who's going to spread is blocked from spreading. So the more people wearing a mask, the better it is. The other factors that are weighed into preventing spread are hand washing and social distancing. When papers have examined the effect of combining these various modalities, the more that it's been done, the lower the transmission rate. There's a paper from Duke University where they looked at 1 million students over several states, and where universal masking was present, the number of transmissions was far lower, in fact, 50% lower than where universal masking was not practiced in the state of North Carolina. So masking, along with all these other factors, is very important in source control. Source control, that is, people who spread the virus. The more people that participate in mask wearing, the better it is, along with vaccination and hand washing and social distancing. One of the new things that's happened is children are becoming a part of this spreading group. They are another source, and they are getting sick. There's a paper, newspaper article from the Wall Street Journal on Monday, August 23rd, and it says, children fill hospital wards. That's not occurred in Washington yet, fortunately. And maybe we can intervene with that if children are also part of the universal masking behaviors. They show, there's a graph in there that shows a dramatic increase in the number of hospitalizations of children in 2021 versus 2020. Our hospitals had about 50 patients, kids hospitalized, and every month about 2 patients are transferred over to Seattle, according to the pediatric physicians. So basically, we're trying to do the things that ought to be done, and the more of it that we do, the better off we'll be. If fewer people get vaccinated, businesses can stay open and events can occur. By the way, Commissioner McKinney, the March 2020 statement by Dr. Fauci was probably okay for March 2020. That was very early in the epidemic and so many things have changed. My guess is he would not support that statement he made in 2020. That's all I got.
Dr. Barg, I have a question about the vaccinated people who are proposed to be able to spread the disease. And my impression is that they are found to have virus on nasal swabs, but it's not clear that those are actually viable virus particles that can infect someone. And the thought is that if they've been vaccinated, they may have antibodies, neutralizing antibodies that will kill the virus within the respiratory tract, and that they're not really the proposed source of spread that you might suspect. Can you comment on that?
Sean, I'm not sure what the status of the virus is in the nasal and saliva secretions. I'd have to check on that. But suffice to say that vaccinated people are less likely to spread than unvaccinated people. I think that's a concept we should appreciate.
And Dr. Barg, I would just make mention of the fact that every medical intervention, as you mentioned, has a risk-benefit equation to it. Obviously, we've all been discussing vaccines and how we favor the risk-benefit equation there. I think when you look at masking, there's a risk-benefit equation there as well. And I think when you apply it to children, I'm not certain what that risk-benefit looks like in terms of language development, depression, all those sorts of things. And so I guess I would just ask, we certainly need to do more work in studying this, because though I'm not advocating that everything you're saying is not accurate, what I'm saying is there is a risk benefit that you're playing out, and you're favoring an intervention because you think it has a favorable risk benefit. I don't know that we know that.
I have one question for Dr. Barga, and likely a comment too, and that to Dr. Atterbury, that just popped in my head listening to what you were stating, and especially when it comes to kids. I know that there are countries all over the world who have done that risk benefit equation and determined that for children especially, that the risk does not outweigh the benefit, so that we've got children in European countries that are not being required to go back to school with masks because it's deemed that it causes more of a problem for them. And I have to imagine, I know I've said this before because I have my youngest is in 3rd grade, and I can attest to the fact that while masks in a surgical setting or when worn properly or are the C95 masks, that certainly we can start talking about effectiveness. But when it is a cloth mask on boys in 3rd grade who are constantly biting and spitting and touching each other in their faces and their masks, and probably rarely hand washing, the effectiveness certainly I think is irrelevant. I don't think that they have any effectiveness whatsoever, and so it becomes more of a costume piece than anything. But my question to you, Dr. Barga, is similar to what I asked Nathan, and how would you speak to, or rather Ryan, with staffing, how would you speak to then, we're down one hospital in our community, that's well known, so we do have limited bed space compared to what we had typically had. So that is something that obviously we're dealing with as a county, as having one major hospital as opposed to 2 in Yakima proper, where the greatest populace resides. So my question is staffing. My understanding is that even that memorial, there are in fact close to 40% of the staff there who are not fully vaccinated. And I know that there are a lot of folks who are going to be leaving, have stated that they're going to be leaving because they've chosen not to vaccinate. So how much, 2-part question, how much of the fullness of the hospital is related to either bed space, or do we not have enough staffing? Because I also understand we have about 100 positions for nurses currently posted at Memorial Hospital. So how much of that is due to staffing? And then what would you say the prospect is, knowing that there's a large portion of the population of employees at even Memorial who are going to walk out on the job because they're going to decline the vaccine, and how that also will impact our community as far as being able to treat folks, because even people in the medical community are declining to receive the vaccine?
So my understanding, talking with the hospital folks, staffing is probably the most important reason that there is a shortage of beds. You can't put a patient in a bed and not be able to take care of them. So staffing is very important. As far as the staff's getting vaccinated, it is a mandate from the state. So there's really no choice in accepting or not accepting the vaccination and continuing to work or not continuing to work. But I will say one thing: if a nurse or a doctor is vaccinated and they don't get sick, then they can keep working. If they're not vaccinated and they get sick, they can't keep working. So it's not a bad idea from that standpoint alone for healthcare providers to be vaccinated.
So you're not aware of what discussions are going to be going forward when we have potentially a large amount of staff who are going to be fired on October 18th?
That's not something that's been talked about with me at the hospitals. I'm sure they have a plan. I'm just not sure what it is.
Sure. Thank you. I appreciate that.
Commissioner McKinney, may I add, I think you're correct about the loss of a hospital. I'm very glad that you brought that up. I think it's often overlooked, and it's something that we elevated many times over the last year and a half, that the dramatic closure of that hospital with no alternatives did have an impact on our community. It also, there were many people who could not find work at that time and who left our community right before a dramatic event. So it did have an impact. And even before the issue of vaccine mandates happened, the issue of bed space was secondary to the issue of staffing. So I think you're correct on that. It continues to make us more vulnerable, which is, again, one of the reasons why we're so interested in the vigilance around safety precautions. Thank you.
Okay, we'll move on to disease control. Ms. Sixberry.
Okay. Good morning. So I'll start with our TB. Since our report out last month, we have discharged a patient from our care. They completed their treatment, so we are down to 6 active cases, which is still quite a few, and they're all over the county. So it's a challenge for our public health nurses for sure. Our STD, we've resumed our weekly testing for STD. So our office we're open to the community, and people can come in for a weekly test. They can come in every Wednesday and get tested for STDs free of charge, and we also offer treatment for them as well if they're positive. I'll just go along with what everyone's saying about the hospitals. They're definitely full. I've noticed I've gotten reports from 2 hospitals so far this morning, and it looks like we're going to be higher than what we were yesterday. Yesterday we were at 54. I'm going to anticipate 56 and upward today, which is nearing one of our high for hospitalizations. There are staffing shortages that we are all very concerned about. The nurses and doctors are pleading. They're burnt out. They've been on the front lines dealing with this for a really, really long time, and we're going to do the best that we can to support them. But I think that's why we all need to come together as a community and fight this, because even if you're not admitted for COVID, it's going to be a challenge to get adequate and standard of care when we have staffing shortages, and bad outcomes will happen because of that. I can give you a little bit of statistics on our breakthrough cases and hospitalizations. So from August 1st to current, there have been 70 people hospitalized. There is a little bit of a lag, and that's due to Memorial's changing their electronic reporting system on how they report those. But 70 people have been hospitalized since August 1st, and 8 of those were vaccinated. So 11% were vaccinated, which is mirroring kind of what's going on nationally. And again, this is from the Delta variant. The vaccine worked really well on the previous variants, but the Delta still works, but not as well. So we anticipated that. We also anticipate the more people that get vaccinated, the more breakthrough cases we will have as well. For breakthrough cases, we've had 271 breakthrough cases out of 3,096 cases. I believe that was over the month since August 1st, which is an 8.7% breakthrough rate, which is still showing a really, really good vaccine up there, along with MMR, measles, mumps, rubella vaccine, particularly the measles. Our hospitalizations for this month have been 2 people for actually from July 1st through yesterday. For 0 to 19 is 2, 20 to 34 is 15, 35 to 49 is 16, 50 to 64, 17, 65 to 79, 17, and then 80 plus 3 individuals. And happy to take any questions.
So, Melissa, if I could, I want to circle back to the question about those in the area that have been hospitalized, although vaccinated. It's my understanding that in that category, typically, those are people that have underlying health conditions, almost without exception. Is that correct? Is that what you understand?
Correct. Yes.
Okay, thanks.
Which we've seen those, why they're talking about the booster for those that are severely immunocompromised as well. They just don't tend to build up that immunity like a healthy individual would. So they're at higher risk for severe disease.
And Melissa, I would just reiterate your comments at Sunnyside. I know the numbers, 92% of the admissions are unvaccinated compared to 7 or 8% that are breakthroughs. And we've also canceled elective surgeries. So if you need surgery for any other reason, you're not getting the care you need. And so it's causing a massive health effect, and that will be felt across our county for as long as this goes on. And so, I mean, I would urge again, everybody to try and step up the vaccination rates so that we can get back to taking care of hips and knees and backs, etc.
I have a question. Are the breakthroughs, how are we tracking breakthroughs? So when someone is admitted, are we pulling up their vaccination records to just confirm through medical records that they've been vaccinated?
So there's a couple of ways we do it. Through our case investigation, we will ask an individual if they've ever been vaccinated. And then we look up their vaccine records and confirm it that way. And then there's also the WDRS, or Washington Disease Reporting System. When it gets put in by the hospitals that they're hospitalized, it also cross-references the Washington immunization database that has vaccine records in it. And if they're hospitalized and vaccinated, it will flag the Department of Health on those individuals. And then they look at that because it has to meet certain criteria to be considered a breakthrough case, meaning they have to be fully vaccinated, they had to have been tested positive. So it looks at different things, and then they investigate those individually at the Department of Health.
So how does that work for our H2A workers? So I think I counted there were 7 outbreaks in our warehouses and growing operations. So how does that work for H2A workers? How do we know if they haven't been part of the system? Is it a voluntary reporting that we're asking them, or how do we cross-reference those folks who are maybe not even American citizens?
Actually, a lot of the outbreaks that we've seen, and something that we reported to the Department of Health, these H2A housing workers are reporting having the AstraZeneca vaccine, and we are concerned that maybe that one is just not as effective here with what strains we have here. So it's something that we flagged to the Department of Health to alert them of, but for those ones, they're not part of our Washington immune system reporting system. So they it would be done through case investigation, and we have the Medical Teams International who's going out and doing these tests, and they're reporting back to us how many were positive, how many were vaccinated, and then we look into those.
And the last question, I appreciated you breaking it down for ages. I had emailed you, and I know you're very busy, but what I had asked is if we could have our situation report that we receive every day be updated to show not only the test positivity that we have in the column that's broken down by ages, but that we have both hospitalizations and death added to those, so that every day we can see how many, for example, of the 0 through 19, you just said 2. So we would be able to easily look every day and see of the 17% of the population in that age group who've tested positive for COVID so far, how many have been hospitalized, how many have unfortunately passed away, so that we could have those two columns added, so we get a real idea of who, breakdown on age groups, is actually being hospitalized. So were you able to work on getting that updated?
So there's a lot that goes into that. When we report this data, the numbers that we report out on the sit rep that says, there's 54 hospitalized, those are coming from our local hospitals reporting those numbers out to us. Those could be people that are in our community, live outside of Yakima County, whereas when we report the age brackets for those hospitalized that I just gave you, those are specific to Yakima County residents because it comes from the Washington Disease Reporting System. So we're looking at two different data sets, and I think that it could cause some confusion if we're putting out what appears to be conflicting information, but it's really, our county residents versus our hospitals. So the numbers that the hospitals send us is more in recognizing when we have an issue with our hospitals being full and getting an understanding of how many patients are being transferred out to ensure that this hospital system doesn't fail, versus the numbers we're reporting out through WDRS, which is of our community members who's being impacted.
Sure. Could we put an asterisk then? I know that is the growing, especially when we're talking about, kids going back to school, we really want to understand fully. I think it's fair that the people in Yakima County can look at that and say, okay, we've had so many people in this age group who've tested positive. How many of those are actually being admitted to the hospital? And that's a really important data set. And I know the state has found a way to do it statewide. So I would really like to see staff work on finding a way to put that to the situation report. I know getting it updated thus far, but hopefully going forward, once you get it updated, it should be relatively easy. And I certainly would accept an asterisk that says that, this is potentially including some people who weren't necessarily county residents who were admitted to the hospital, but at least having an idea and to be able to put that in perspective of how many people in each age group are testing versus how many of those people are actually going to the hospital is important for us to give that information to the community.
I don't think doing it on a daily basis is something that we can do for a couple of reasons, because you're looking at a very small number, which can make things identifiable. We also have an issue, as you know, last spring, there's a lag in the hospitalizations being reported. So if I run the report today, it's not going to be reflected because it can take up to 2 weeks for all that information to be put in. But I think a reasonable thing we could do would be to do a 2 weeks, 14-day period and including that 2 week gap. So essentially the information would be 14 to 28 days out.
So you're not able to just provide it. So this is a rolling right now. The situation report continues to be added to every day. So you're stating that you wouldn't be able to provide that data thus far, because it would be less identifiable, because we're talking about since we started tracking positivity for COVID, how many of those people are being hospitalized in those.
So you're wanting an accumulative rather than a period of time.
Correct.
I think that's something that we could look at. I misunderstood too, Commissioner McKinney. I thought you wanted actually specifics around each day, which again, we were very concerned from a HIPAA standpoint could be allowed, and that's why we have caution. Also,
yeah.
And the other issue though, and in fairness, we do spend a great deal of time, when I say we, I mean our staff, certainly our nurses, reviewing the data and reviewing the information to make certain that it is the correct data. So I think we can work on a rolling concept, certainly.
Yeah, I think we could definitely.
I appreciate that. Melissa's made it very clear, and I respect that. We don't want to do it where we can identify. That's why I thought and I do believe that the cumulative will actually be more beneficial to get an overall idea of the impact.
Yeah, that certainly makes more sense and is doable. And then also just having the asterisk in there that the numbers will change because of a lag.
Yeah, perfect. Thank you. I appreciate that.
And I agree that would be helpful information to have that.
Okay, we'll move on to environmental health. Mr. McGee.
Morning, everybody. Everybody hear me okay? Okay, my microphone's working good today. So a couple things I want to talk about in environmental health. I've been in conversations with Department of Ecology, WSDA, the Washington State Department of Agriculture, in regards to the groundwater management area in the Lower Valley. There is an implementation committee from decisions that were made at the Guama meetings in the past. I came into my role right as the implementation committee formed. So, and then COVID hit, and that's been on pause for a little while. But we are discussing availability for dates to meet again and start moving forward on some of the implementation plans for the groundwater management area, which includes, soil monitoring, groundwater monitoring of wells for higher levels of nitrates in that area. So more to come on that as I know more and we start having these implementation committee meetings again. So I'll keep you all informed on that. For environmental health programs, lately, we obviously have seen a spike in COVID cases, and we also are dealing with some poor air quality these last few weeks. And unfortunately, the air quality doesn't seem to be getting any better anytime soon as the Snyder Creek fire continues to go on. So we've altered our approach to our field work a little bit in respects to COVID transmission. Where we're in doing our food safety inspections. Those are indoor inspections. They can be quite lengthy if we're working with a food establishment on some issues. So what we've done is kind of targeted our at looking at a lot more of the high risk critical areas in food safety inside of our food establishments to cut down on our inspection times. We're trying to limit our time indoors in close proximity to the public and employees of these establishments to less than 15 minutes. It's tough to do, but we also recognize that we need to have a presence out in the food industry in Yakima County to ensure that our restaurants and food establishments are as safe as possible. We will then, fill out our inspection reports like normal, except we're doing those back out in our vehicles, and we'll be meeting with the food establishment operator in an open air space to discuss what's going on with the inspection, what corrections we need to make or changes we need to make. Basically, we're trying to limit the possibility of any transmission happening. Of course, we're still masking and trying to remain socially distant as much as possible. So this is done for staff safety, public safety, and the safety of the restaurant operators, employees. So in terms of air quality, we're right in the heart of busy season for land development. There's a lot of outdoor inspections. Those can take quite a while. So what we're trying to do is on really bad air quality days is do things like having test holes that we have to evaluate ready upon arrival, so we don't have to stand outside and wait for a backhoe operator to dig the holes. The operator can dig holes and wait in the vehicle with some filtered air going on. We're having staff wear N95 masks outdoors and trying to space our inspections out so staff can get reprieve from that poor air quality throughout the day. Again, it's busy. There's a lot of inspections to be done, and we are keeping up fairly well, but the air quality certainly isn't working in anybody's favor. So we're keeping that top of mind for staff safety and the safety of our stakeholders that we're out there working with, trying to keep exposure to that minimized. Is there any questions on those items thus far? Okay.
This is Nyla. I don't necessarily have a question on what you just reported on, but going back to the Friends of Toppenish Creek and their written comment, I'm pulling up a letter that they sent us back in February of to February 23rd of 2021. I was hoping maybe at our next regular meeting, part of your report, you can speak a little bit about the chemical action plan and what Yakima County is doing to address the PFAS in Yakima County. So I know that you mentioned that you're working on that, but if you can just give us an update again, make sure that we're reaching out to the Friends of Toppenish Creek, and we are actively being kept up to date on what's going on with that.
Yeah, and I think with that, as far as the, the chemicals or the PFAS being spread over croplands in Yakima County, that's going to involve other agencies as well, Department of Ecology, Department of Ag. So there's going to be a coordinated response to that about what can be done or what needs to be done, and how that is being monitored. And I also know there's the concern with the training center for PFAS for firefighting agent that they use, and there's some groundwater monitoring going on by the Army in that area to ensure that the neighbors of the training center are in fact safe and not being affected by this. So I can dig in and do more research on that, and I can gather more information and go into greater detail on that at our next meeting.
If I may, Sean, thank you, Ms. Duval, for bringing that up. It's a great opportunity when Sean does his report at the next meeting to explain how we work in concert with other governmental agencies that actually have the legislative responsibility over those issues. Thank you.
And perhaps we
So,
could just
Sean-
get a little background on this whole issue, because I know that they've sent letters to the Board of Health over the past several years, and I think there's some history that I'm not aware of.
Yeah, absolutely. I can put together a background presentation, and then we can go into details about the current issues and what we can do moving forward, or what's going to be happening moving forward.
Thank you.
Sean, the city was also notified by the Yakima Training Center prior to the public notification going out of the PFAS investigation monitoring they're doing there on the training center and possibly outside of the training center, depending on what they find. So I'm hoping that as we look into the situation in Lower Valley, that you'll also be able to track with the training center, what they're finding out there. And I know that it's all about collaboration and working together. So I appreciate that, Mr. Fresco, that we can be updated on that as well as you're doing that.
Yes, and I have been in contact with the Army and their representative from the training center about the monitor they're planning on doing. I sent over information for them to use to identify wells on certain parcels within a certain proximity of the training center's borders for them to get started on possible monitoring of that situation. So I'm working directly with them. They are in communication, and certainly if there's anything that comes up that is an issue that needs to be held, we'll be one of the first people to know. So
thank you. They did show me the list of wells, so I'm sure they had received that from you. So appreciate that.
Yep.
From the county's perspective, I can say that we have provided them with obviously a lot of documentation. I think overall, and Sean will speak to this, but the ground water testing is part of a decades-long agreement going forward to do studies and testing of these wells. So everything right now is being run by, let's say, higher powers than the Yakima Health District. But everything that we are hearing about from the Friends of Toppenish Creek are certainly, they have their own perspective about how the plan is being implemented, but it is certainly an agreement that was a multi-agency agreement that is going to go forward for many decades to monitor these wells. So it'll be good for everyone to get the update.
absolutely. Yeah, I'll prepare that, and at our next regular meeting, we can discuss that in detail. I did have one more item. Any other questions or comments on the groundwater? No? Okay. I want to move forward and talk about events. So we do have several large events scheduled for late summer, throughout the fall in Yakima County. Obviously, there are concerns with the increase in COVID activity on and how these events can be affected or be potential spreaders or transmission points for COVID. And some of the big concerns we do have is that, you know, the Delta variant is more infectious than the previous strains of coronavirus. You know, we're seeing data that is showing that younger people are being infected more due to Delta variant. And we do have people under the age of 12 not eligible for vaccine. That paired with, there are still a large number of people in Yakima County that have chosen not to get vaccinated, as well as there's no mask requirement in outdoor settings. So we have all these things that lead to large outdoor events that have the potential of unvaccinated people, no mask being worn, with where social distancing really isn't all that possible. You could be at a concert, but it could be a fair, it could be a large food event, you know, whatever the setting may be, social distancing is hard to achieve in these events. And where masking is optional, we are certainly going to have people not wear masks. We have seen other counties or local health jurisdictions come out and outright say large events are not recommended at this time. But if you choose to have them and choose to attend, please consider the following. We haven't necessarily recommended not having events because they are legal at this time. There's no restrictions on those. However, we are working with event operators, planners, etc., on safety steps that they can take to minimize transmission in these settings. We are working in conjunction with state guidelines, which right now in an indoor setting, masks are required. So an event that has indoor portions to it, when people go from an outdoor setting to the indoor setting, they need to have masks available and put those on. And masking in the outdoor setting where social distancing cannot be maintained is strongly recommended. So what we are working on with event organizers is, you know, having an excess in hand sanitizing stations around the event, having maybe at the entrances to indoor areas of an event, having an ambassador or a staff person there able to hand out masks for folks who didn't bring one because they're not required outdoors. We're also recommending that signs be posted at entrances of events, indoor, outdoor, you know, where indoors setting is, as masks are required per state mandate. At the entrances to an outdoor event, same masks strongly recommended. Also communicating up our outreach to the community is that right now with transmission the way it is, the best thing to do, vaccinated or unvaccinated, one of the best tools is to put on the mask at these events. Social distancing cannot be maintained. Transmission could potentially be very high, and we can see a lot of disease come out of these events where, you know, I think in Yakima County alone, there's over 100 cases due to the watershed festival over at the Gorge a few weeks ago. So, you know, it is a concern. We know that these events are happening, and it's great for the community. They need these events, but we also have to take steps out of respect for the current transmission rates of coronavirus in Yakima County. So we're working heavily with event coordinators to implement these safety tools at their events to allow them or hopefully reduce the potential of it becoming a super spreader type event. I'm happy to entertain any questions or talk about this any further if anybody has concerns. That's really all I have to report right now. So yeah, I thank you all, and I'll finish there.
Thank you. And now for public health partnerships, Ms. Bravo.
Yes, thank you. So I wanted to talk about two initiatives that we haven't heard about quite yet. So the first being the Youth Marijuana Project. So we received funding from the Washington State Department of Health through the Youth Marijuana Prevention Program to work with local clinics to implement a pilot project to provide medication lockboxes to families that tell their provider that they use marijuana and have children in their home. So what this project will do is have the providers offer medication lockboxes to these households to help reduce youth access. The clinicians and providers will also provide education to families on the effects and consequences of underage marijuana use. Again, being able to provide an actual tool, but also being able to provide education for those families is what this project will entail. So it'll be a 6-month project. And as part of this project, both the Yakima Health District and the Washington State Department of Health will evaluate this particular intervention or project with the intent is essentially to publish the findings into the academic literature. So we're hoping that the combination of education and an actual tool to lock up the marijuana to prevent underage use will have good outcomes, but if there are negative outcomes as well, we'll also report those. So we are excited to have been selected by the Washington State Department of Health for this opportunity. And of course, we'll share updates once those findings are available. Currently, we are working with Yakima Neighborhood Health Services, but we hope to expand with other clinics in the area as well. The second update is around the breast, cervical, and colon health program. For the last year, we ended up being able to provide screening services for 1,039 women. So just as a reminder, the program assists uninsured and underinsured women to access cancer screening services through a partnership with various health systems, which is the hospitals, clinics, radiology centers, across the 7 counties that we administer the program for. So the Yakima Health District not only serves Yakima County, but also most of Eastern Washington through this program as well. Through the last year, we identified 11 new women that had cancer and assisted them into getting their cancer treatment, which makes it a total of 41 women who are currently receiving cancer treatment services through a direct result of this program. And then back to COVID. So a few weeks ago, Memorial reached out to the health district to partner on messaging, which would place local providers at the forefront of the messaging. So this communication campaign will center around the provider experience. We'll be having providers from the hospitals and from local clinics talk about what they're experiencing in terms of, as we've heard, the hospital's full, that they're tired and burned out, but also addressing some of the common misconceptions around the vaccine, and then also, of course, promoting vaccine uptake and mask use. So this initiative is being jointly funded by both the health district and Memorial Hospital, but again, will include various providers from our local clinics and hospital systems. And the filming took place earlier this week, and we look forward to sharing more of that once that's available. And then just a quick update as well. If you are aware, over the last year, we have partnered with Signal Health to implement a masking survey. So that's all volunteer-based, where volunteers from the community go out at a specific time at a specific place to observe how many people are wearing masks in indoor settings. Typically, it's grocery stores that people go to. And in the last survey that was conducted, they observed 43% of individuals wearing masks in indoor spaces. So again, the recommendation was at the time currently for 100% of individuals to wear masks when in indoor spaces. That was last weekend. So we'll continue to do that volunteer-based masking survey, and of course share updates as they're available. Are there any questions?
I had a couple. Was there any talk in your communications when you're working on these studies, so the youth marijuana education study, was there any concern about if we're starting, we're trying to promote the idea of youth not using marijuana? Was there any discussion of perhaps the perception of mixed messaging coming from the state when marijuana was given as an incentive to go get a vaccine?
This would be specifically for families with children 18 and under. For that, is that what you're getting at?
Yeah, just so we're embarking on a campaign about educating youth about marijuana, and yet we had it offered as an incentive to go get a vaccine, which we're also stating is something that's good for you. So I'm just, was there any discussion about there being some mixed messaging on those two topics?
No, but I will say again that this is targeted for families of those 18 and under, and the education is for underage use of marijuana.
Perfect. So no discussion of mixed messaging.
Well, if I may, Commissioner McKinney, one of the reasons that we're so interested in lockboxes is the same reason we're supportive and promote the safe use of stored and locked handguns. We don't want children specifically to have access. And one of the things that changed years ago was when edibles specifically were available. We don't want children eating anything with drugs in it. And so it's not just an education issue, it's a safety issue. We don't want people to ingest a dangerous substance that can then send them to the hospital.
Absolutely agree. All my firearms are locked up and for good reason. So I just was concerned about the mixed messaging perception. The other, you brought up the marketing campaign with healthcare providers. I'm just curious if we're also going to hear from our local healthcare providers who are continuing to want to serve the community, as they've served the community on the front line for the last 18 months, but unfortunately are going to be pushed out of their position on October 18th. So are we going to hear from those folks who are still desperately wanting to serve our community?
So the way that the outreach works for the providers is we go directly through the administration and they select the providers who will be participating in the campaign. So at this time, we are going to be focusing on, again, that provider experience about being burnt out, and then also addressing some of the common misconceptions around vaccine use and promoting the masking. But so at this point, I don't believe so. But again, we did go through the administration of these different systems.
Perfect. Thank you.
Lillian, if we were interested in taking part in that as a member of the health district, would that be available to us? Vaccination.
Yes, we're happy to explore further opportunities for this one. We did just wrap that up, but I'm happy to, we always want to hear the voices of our Board of Health members, so we can definitely look at further opportunities to do some more messaging, and as some of you have done before, so I appreciate that. Thank you.
Okay, thank you. Okay, we'll move on to unfinished business. So the hospitalizations and deaths attributed to COVID-19 audit. Mr. Johnson.
Yeah, thank you. Following up after our last board meeting and the request from the board to ask the hospitals kind of what it would take to conduct a in-depth chart review audit of COVID-19 patients as well as COVID-19 deaths. I did send a list of questions to all three hospitals to have them respond with kind of what this would take for their organization, and all three of them gave very, very similar answers. Really reporting that they're really struggling right now with the increase of COVID patients and staff burnout, and they do not have the bandwidth at all to be able to do this sort of audit. They reported that their focus will remain on patient care, and that if this audit were to take place, they would have to outsource for someone to come in and contract with them to be able to do that. It'd be a significant cost, significant time strain, and many of them reported that this was an extreme ask because they do follow the reporting definitions laid out by the Federal Department of Health and Human Services, and they report that directly to Department of Health within the disease reporting system that we talked about last meeting. So at this point, the organizations really don't have the bandwidth capacity at all to be able to do any sort of audit around this. Happy to take any questions.
Well, I do know that our coroner has expressed his desire to assist, and so perhaps it's something that our coroner can work with you, Melissa, and Nathan internally to at least do a review of all of the hospitalizations and especially focusing on deaths attributed to COVID, folks with comorbidities. So maybe we can do something more of the data, scrubbing of the data that we do have access to internally.
So happy to have Melissa chip in on this, but that would be an extreme ask for Melissa and myself to do. I'm certainly not qualified to be able to do it. It'd fall on Melissa's shoulders to be able to do. And I know she does work with the coroner on deaths specifically. And also we don't have access to a lot of the data as it relates to in and out of county residents.
Well, I think what's being overlooked here is to get an accurate number, you have to know all the cases that were due to COVID. You'd have to know all the ones that were false negatives and all the ones that were false positives. So you would have to review essentially every single hospitalization and death over whatever time period you're looking at to get all those that were listed as COVID but not due to COVID, and those that were not listed as COVID that were actually due to COVID. It would require an extensive chart review, and it would be a huge undertaking. I don't know how many hospitalizations are done per year, but that would be an extensive chart review.
I guess I just expressed my shock that the last time I checked, people were more important than dollars, and we seem to be jumping at the opportunity to audit our financials. In fact, it's required in cases of this where we have an extreme expenditure over and above our normal budget, and we're jumping to go through those hoops, and everyone acknowledges we absolutely need to audit the dollars that are spent, but we're not as interested in auditing the numbers when it comes to people. So I think it's disheartening. I hope that those providers would voluntarily determine that at some point they would want to go back and look at the books and see if we're looking at information that is accurate.
I don't think it's a money issue. I think it's a manpower issue. And if there were a slight deviation in the number, what would you use that deviation to accomplish?
Well, and that's what all of the hospitals ended up asking is what's the purpose of it? What's the benefit of it? If they come back and they say they had plus or minus 2 hospitalizations or plus or minus 100 hospitalizations, at this point, our healthcare system is still extremely burnt out. They are dealing with not only COVID patients, but very sick patients that are coming in for other aspects. And that's really where their focus needs to be, is really focusing on that patient care.
So you said, what is the benefit of the audit?
Yes.
What would you do with the information is the question. It's not going to change what we're doing. So do we want to put efforts into something that what would you want to do with the information that would?
Why do we do an audit of anything? And hopefully what we're doing is confirming in an audit that everything that we've provided as far as data is accurate. It's simply a verification that it's accurate. I hope that's the whole point of an audit.
Commissioner McKay, I have a response, but I was hoping to allow for Ms. Duval to speak.
Thank you. My only question or follow-up was to Mr. Elliott to provide again the clarification on the legal authority of the board that it has over this audit request. Do you have a chance to look into that, Mr. Elliott?
Well, as we discussed before, the powers and duties under 7005-060, I mean, I can read them all again to the board, the obligations that are there. If you're asking if there's specific language in there that talks about the ability of the health district or the board to require an audit, et cetera, I mean, that's not in there. So I don't know what else you want me to say, Ms. Duval, on that. I mean, we've gone through the powers and duties before, so.
I just wanted clarification. Again, it's that request is not, it goes beyond our powers and duties. So thank you for that clarification.
That's never been something that wasn't known. This is absolutely something that we understand is an ask of these private companies. I just hope that they would be compelled to do the right thing and perform an audit in conjunction with our health district so that we could be assured that the data is correct.
And Commissioner McKinney, you did raise a good point about making certain that data is correct. I think what we use very broadly in emergency response is the concept of an after action report, where you review what was done or you convey where inroads could be made to improve data collection or response or communication. So I think that the idea of looking backwards at the end of this post-recovery to see if everything was correct and responsive, that makes sense. But we are really in the midst of a fight, and we are forward facing, and we do have depleted resources. And our goal is, again, to look to the future to save lives and improve the welfare of the community. And I think that's what you're hearing from our partners in healthcare, which is their focus, their efforts, and their staff power are being spent to fight a deadly disease.
Thank you for that. That's exactly what I was going for, Director Fresco. So I suppose that given Dr. Barg's comment last meeting and this meeting, that we can expect a look back in maybe the next 10 to 15 years when we've gotten over COVID.
That's all,
Okay.
Dr. Cleary, that's all I had on that specific.
Okay, thank you. All right, so we'll move on to new business. Mr. Fresco, the communication with the State Department of Health.
Yes, thank you. It was brought up again at our last meeting by Mayor Byers. Thank you for your patience, Mayor Byers. We wanted to discuss our communication with the State Department of Health. I'll attempt to answer your question and happy to have a more detailed conversation if you'd like to. I have shared many times that the public health system in this country is a system based on communication between local, state, and federal partners. It's always been dependent, both financially and in terms of legal authority, on a relationship between partners. It is normally a very supportive, congenial relationship. There are times when we have odds and disagree on moving forward. So it is a series of compromises. Normally, our communication with the state is really on all fronts. It's on communication techniques. It's on finances. As you heard from Chase, we depend largely on state and federal funding. It's based on policy. Ryan spent a great deal of last year working on policies that were directed to us at the local level regarding schools. And it is a discussion that is forward-looking in terms of future opportunities. I think, if I'm not mistaken, Mayor Byers, you had asked about what our discussions are routinely with the state. Am I conveying that correctly? I want to make sure I'm answering your question.
Sorry, I had to get unmuted. Yes, I just want to know, as you're communicating with the state, what are you communicating with them? So when you have these, I think there are weekly communications with them. You have a weekly telephone call.
Well, we have a series of weekly meetings that are normally updates, and those updates really are used to be more two-way communication. Now it's really one way. It's coming from the governor's office or the State Department of Health. There are a number of weekly meetings that we're on, but when I say we are on, the entire state are on. So they are update meetings that have to do with communications about what's upcoming. So as an example, as we shared with you, we had great concerns about FEMA funding running out. And so we conveyed to the board that FEMA money for vaccines was critical. It was going to run out in September or the beginning of October. We were concerned that we needed to be prepared for the next 3 months out. We conveyed that to the state. We made it clear to the state that it was necessary to request to FEMA that money be made available, or at least the opportunity for that money to be made available well in advance of the deadline. If you recall, the federal government has a September 30 fiscal year, so October 1st through September 30. So there's a tendency in large bureaucracies to wait till the absolute last moment to share that there's new funding available. That wasn't going to work for us for initiatives locally. So we had those conversations in earnest. Those were conversations that many shared statewide. To our benefit, the state conveyed that to the federal government, and the federal government acknowledged that there would be continued funding through the end of December. So those are the types of examples of conversations. I don't know if you're talking about specific perspectives that we're sharing, but those are the kinds of things that we're doing to secure the best possible outcomes in Yakima County, given the compromises that we all have to face when we are not the decision makers on many of these issues.
So I did want to include perspectives on that, that if we are giving the state, for example, some feedback on different perspectives in the community on issues around anything, but particularly, you know, as everyone's aware right now, of the different perspectives on how we're responding to COVID. And specific, my question is, I know that previously, I do not know if this is happening now, and I'm just curious. I know that previously, then Commissioner Vicky Baker was a part of those weekly conversations. I'm wondering if there is a county commissioner now who is a part of those weekly conversations.
No, and I will share with you that one of the reasons I think that we're having less communication with the state is because there was a great deal of anger and reaction to oftentimes what the state was doing. And so what we're now seeing, frankly, is less communication coming. We had more two-way conversations in the past. We had more of an opportunity to discuss potentials. We advocated fiercely in rural Yakima County, as an example, that the state was ignoring the needs of rural communities. But those conversations have largely dried up because, frankly, there was a request at the local level to know things as they were in process, which caused concern for the state, and the state stopped sharing information with us. So we are often now not in discussions about potential things. We are the recipients of the decisions that are made. And that is a dramatic change from what I've known in my 9 years here in Yakima County. Before, it was conversational and it was collective, and it is now far more top-down.
It's extremely disturbing, Andre, what you're saying. If in speaking of concern, representing our community, we're now being talked down to or talked at the state level. I mean, I would think that a government agency would want to hear from the citizens, would want to hear from the elected people representing those citizens, and to have them, I don't know, offended, to put it a better way, or taken aback by questions we were asking, certainly seems surprising. I think we should ask more questions about that.
Well, Dr. Atterbury, I'd like to be clear. The normal lines of communication that happen for elected officials or people in government, there are normal channels for that circumstance. It is a very unique situation to have a public health disaster of this magnitude. So what we're seeing now is a focus on public health that ordinarily you would not see. And so traditionally, if an elected official or an elected person or an appointed person in a governance role with a city or a county, they have normal channels of discussions with the state through advocacy, through lobbying, through normal channels of communication. That has been changed because of public health mandates and responses. It has inflamed the normal way that people communicate, I would say. And so there have been discussions at the state level. But what I'm sharing is that there is less being shared because the reaction of that information in advance of a decision was met with a lot of anger. And so what I'm sharing with you is I cannot convey to you what the reason behind it is. All I can share with you is the outcome, which is less communication, less awareness, less timely preparation.
So
I would just like to speak with that, just to your point, Mayor Byers, that what Director Fresco is speaking to is true. There is only one-way communication. Elected leaders across the state learn about the mandates from press conferences in real time with everyone else. And I would say that the only reason why we're in this situation is because we continue to have one person who makes decisions for over 7 million people. And he maintains that authority by a temporary emergency order. And so wasn't it a brilliant thing to have legislature, the three bodies of government, so that the people's voice of dissent can be heard? But unfortunately, there is no room for dissent. We have one-man rule. And the best thing we could all hope for is a return to have our legislative body, the people who are represented to voice our concerns, create laws that have been vetted the way that our founding fathers envisioned. And this is not truly the way our founding fathers envisioned mandates by one rule. In fact, I think that's why we ended up becoming the United States of America, was to escape one man rule. So I would just like to state that to your concern, I can confirm that there is no way to communication whatsoever from the governor's office. He continues to make decisions as one individual for every person in the state of Washington.
So thank you. So I'd like to go ahead with my response to Dr. Fresco. I'm sorry, Andre Fresco. And that is, I was hoping that you still had more two-way communication than we as electeds have had, because I have experienced the same thing in that early on, the governor himself would talk to us. And then after a while, and because we did share some different perspectives than what he had, his representatives would talk to us. And that was quite frequently. Now it's less frequently. And as Commissioner McKinney has stated, it is now often just updates where we get information and we share opinions and thoughts and questions that are supposed to go to the governor. And I don't know whether or not they do, because there's never really any confirmation or follow-up on that. And so it's been very disappointing, that we have lost the ability to be able to voice opinions of individuals or communities or groups, to a governor who is non-responsive in terms of anybody that disagrees with him. I was hoping that it would be a different situation with the Board of Health, because I knew you had ongoing conversations. I did not realize that your situation was the same as ours. Now, basically, it is when everybody else gets the information, we do too, in terms of the mandates coming out. And so I'm going to agree with you on that. Commissioner McKinney is very disappointing. And I agree with you that is not the foundational formation of the government that we are supposed to have in place. Thank you. Thank you for responding, Mr. Fresco. I appreciate that.
Thank you, Mayor Byers.
Mr. Fresco, do you have anything else?
No, sir, I think we can move on.
Okay, well, let's move on to the other new business, vaccine mandates. Commissioner McKinney or Lynn? Go ahead.
Well, I know that I had requested this. It also looks like I looked at the updated agenda, and Commissioner Lindy, it looks like, was also added to this. So so he might also have something to say, but I felt it warranted health board discussion and potential action. I think that we can all agree that the vaccine is readily available, and we've done a phenomenal job of getting it out to every corner of Yakima County. It remains free, low barrier. And ultimately, though, people need to be afforded the opportunity to make an informed decision, and that decision should be retained by that individual. And our job is to support each other as a community, which that also means supporting individual choice when we're talking about a permanent change to someone's physical body. And I think that anytime we've come to a point where we have, again, someone trying to assert under a temporary order to make a permanent change that cannot be taken back. It cannot be taken back. So this is not a helmet on a bicycle. Someone would be able to easily take that helmet off and cast it aside if they decided to. But this vaccine truly does enter your body. It will stay there. And I don't think it's appropriate for one man, the governor, nor do I believe it will be found to be constitutional for him to do so, to create a law under an emergency order. He's there to rescind and temporarily hold on laws if he thinks it's for public health. But creating a law, to my knowledge, is not explained in any RCW for adult vaccinations in the state of Washington. That body and opportunity resides with our legislative body. So I would just like to see discussion and hopefully an action that this health board considers going on record that we do not support mandated vaccines for COVID-19 in Yakima County.
I could make a comment regarding the vaccine. The material that's injected is messenger RNA, which degrades very quickly within the cell. It stimulates the production of the COVID spike protein, which you would have in your body if you got COVID anyhow. So the material that's the vaccine's made out of doesn't exist after probably a day. It's all gone once it does its job. So the antibodies that it creates, that's what's around in your body for a long time, not necessarily a lifetime. And that's what protects us.
there are other components that make up the vaccine. So again, I think it's hard to argue that when you're putting something into your body, that's a personal choice, because you are having something injected into your body, and what remnants of anything that goes into that vaccine remains, who's to say how long it will be there? And that hasn't been studied enough either. So again, whether or not part of it remains, or how long the shelf life is of anything that remains in your body, it's certainly causing a change to your body, and people get to decide whether or not they want to receive that vaccine and alter their chemistry.
Commissioner Lindy, I know that you had sentiments you wanted to share. I wanted to make certain that you had the opportunity.
Yes, thank you, Mr. Fresco. I guess I'd like to say this. You know, my when I first got involved and sought this position, really my priority was to go to bat for and defend our, the businesses, schools, and churches of our county. And I've had some, along that way, I've had some reasons to be less than confident sometimes when we get these emergency orders that come from the governor. However, I've also taken the time recently to spend a lot of time conversing with medical staff, physicians, and leadership in hospitals throughout our county and elsewhere. And I do have quite a bit of confidence in them. And what I've heard is the following. First of all, and some of this is information that's already been shared in the meeting today, but in our hospitals in Yakima County, yes, I think the count today was we have 54 hospitalizations. Our peak was 70 last January, so we're heading back in that direction, and that does concern me. We are seeing that, as been stated before, that the overwhelming majority of those are people that are unvaccinated, although there is a small minority of people that have received the vaccine and yet been hospitalized again. We're also seeing that although the pediatric cases are still low, that they are higher than they used to be, and we're seeing more of an infection rate among young people. And I see Melissa just said that the hospital count today is 63. So we're getting right up near that peak where we had last January. And I don't believe we can turn a blind eye to that. I've also heard from facilities such as Cadillac and a hospital down in Portland. OHSU hospital had a couple of days ago, they had 35 patients in their ICU, and 34 of those were unvaccinated. But the other thing that's also concerning, which is a universal theme here, is that these hospitals, their staff are really stretched thin. It's an issue of staffing. It's also an issue of capacity. And we're seeing, for example, the hospital in Portland is getting requests from states such as California and Nevada to place their patients. Cadillac has had to reach out to Montana, Idaho, and even Alaska to try to find a place for to place patients. So we are seeing a situation where our resources are stretched extremely thin. I do have, for my part, I echo what Dr. Atterbury said earlier in that, I do encourage people to get the vaccine. I'm not a big fan of mandates, but we have seen that through information that the vaccine has been shown to be safe and effective. Of course, no vaccine is risk-free, and if anybody has a question about it, I've heard people that have compelling concerns, and they should talk to their doctor about that. As Dr. Atterbury had mentioned earlier, elective surgeries have been shut down, and so it's not just an issue of COVID patients, but it's an issue of other patients not receiving the care we received, which is we're in the same boat we were a year ago with these waves. So these are significant issues, and so. I'm also concerned, although I said I'm not really, I want to encourage the vaccine, not really in favor of a mandate, but I really want to strongly encourage people to get the vaccine. I think I do also have concerns about the governor's vaccine mandate, in that from a practical standpoint, if our hospitals are already stretched thin, let's say that out of those 30% or 40% or whoever doesn't want to get the vaccine, and let's say 10% of them follow through and actually leave their jobs or are discharged rather than get the vaccine. That's going to have some really serious consequences for our hospital. I think we're going to see some similar issues when we look at education, we look at our firefighters, that are also having these same mandates placed upon them. Again, I encourage them to get the vaccine, but I am concerned from a practical standpoint of the effect of holding this, holding firm on that mandate. And so because of that, I actually would like to propose a motion for the board to consider. And I just actually sent this off to Ryan to distribute to the members of the board, but I'll go ahead and read it to you while you're waiting for that to arrive. And it would say the following. Although no vaccine is risk-free, the COVID vaccine has been shown to be safe and effective. However, due to the resistance to the COVID vaccine among some members of the public, we recommend that Governor Inslee give alternatives to the vaccine requirement, such as a weekly COVID test or an immunity test. So I'd just like to give a minute or two for that to get to you. Ryan, did you receive that?
Yes, I did, and I'm sending it right now.
Okay, thank you very much.
Commissioner Lindy, I'd like to ask both you and Commissioner McKinney for a clarification, please. Is this something that you are asking for on behalf of the board, sending something to the governor?
This would be from the board. That's my intent. It would not be from the health, but from the board.
Thank you.
Yes.
LaDon, I would just make one comment, and Dr. Barg will probably weigh in, but the immunity test you're speaking of, there has not been a well-established immunity test out there because it really depends on the target you're looking for. Are you looking for antibodies? Are you looking for T cells? Are you looking for B cells? That's a moving target, and that's why it's not very practical to test people's immunity to the virus, just whether or not their vaccination status is positive or negative. That's really the best that we have.
Okay. All right. Well, I appreciate that, Dr. Atterbury. If that's the case, if that's not a practical request, then I would remove that, which would be the last four words, to take off or an immunity test. Then, if that's not really a practical solution, then let's remove that.
Would you like to restate a motion if you're making it?
Sure. I move that the board considering the following statement. Although no vaccine is ever risk-free, the COVID vaccine has been shown to be safe and effective. However, due to the resistance to the COVID vaccine among some members of the public, we recommend that Governor Inslee give alternatives to the vaccine requirement, such as a weekly COVID test.
Would you mind, I'm wondering if it explicitly says to rescind the vaccine mandate.
Well, it does not say to rescind the vaccine mandate, but I guess it would be loosening up or giving alternatives to it.
I mean, in my opinion, I guess it's not practical to fire every nurse, every doctor, every firefighter, every police officer, and every school teacher that doesn't want to get vaccinated. That just doesn't seem like a practical answer to me. I don't think anybody is entertaining actually doing that. Correct me if I'm wrong.
Well, Dr. Atterbury, I agree. It doesn't seem practical, but and maybe someone correct me. I think I've heard from some of the affected staff that there will be that they are mandated to do that, and there will be penalties for them if they do not follow through. And perhaps somebody can verify that, but that's what I've heard from one of our local healthcare officials, who I think would know and be in a position to know.
So I have a question. Maybe this is for Mr. Elliott. Aren't vaccine mandates now legal and within the purview of any business to impose a vaccine mandate upon its employees?
So first of all, very complicated question, but I will identify for you that I do know, I think it was in July of this year, the Department of Justice had issued its guidance on this very question when asked. I know the governor cited to that. And by the way, there are a couple of things I want to bring up for the board. And this is an area that I'm happy to talk about. I've researched this in preparation for this meeting. I want to clarify some things that Dr. Barg said earlier. But the first thing to know is and this is important for any of the healthcare workers or any of you getting questions from the healthcare workers. The governor had come out with the initial vaccination mandate, which was 21-14. Over the weekend, what is identified as now 21-14.1 actually did not make its way onto any forum until Sunday morning when I found it. It goes through some of these issues. It identifies the requirements on both the employees at levels of state agencies, healthcare providers, and the educational settings. And if you have not read 21-14.1, everyone should read it, and everyone in the community should read it, frankly. What I would say is the governor there identifies through the Department of Justice on July 6th, that's the Office of Legal Counsel, United States Department of Justice. They issued a legal opinion on this issue and stated that they were not prohibited by federal law from imposing. That was the Department of Justice position. The EEOC is another agency that people often look at on these issues, especially as it relates to employee-employer issues, which, by the way, if we set aside everything else that's going on right now, this is an employer-employee issue. And I think that's important for people to understand in the community to one degree, and I'll cover that in a second. But I do know that the EEOC had issued guidance throughout the course of the summer and has recently updated their guidance on this related to vaccinations, their interpretation. Keep in mind, the EEOC is the entity that would fight on behalf, essentially, for a worker placed into the position of sort of having to deal with some of the questions related to vaccine mandates, how it relates to the ADA, also to Title VII and the identifiable federal laws available for employees. So to answer your question, Dr. Cleary, the DOJ and the EEOC have issued guidance on this. And a United States Supreme Court, I think it's Jacobson versus United States from a long time ago, dealt with a sort of vaccine type issue or a immunization issue before. But there's no Supreme Court opinions that have dealt with this question. It's going to come down the pike at some point in time. I am never going to claim that I'm smart enough to be anywhere near any of those people who will make those decisions. But I will say this, and I want to correct Dr. Barg on one thing. Dr. Barg said those employees have no choice, and I actually disagree with that. And if any person reads 21-14.1, you will see that the governor has required employers to comply with federal law, like he has to. And as I said a second ago, setting aside everything else that's going on in public health, and I'm asked to look at the legalities of this issue, this to a certain degree runs into an employer-employee issue as it relates to the exemptions. The two that are identified in here, and anybody can find them if you look at 21-14.1, there are a couple that are identified, and there is an obligation, as the governor points out, for all employers to allow those exemptions to take place. And there's not a requirement on employees who qualify for the exemptions. And there's essentially then it gets placed in a position where the employee, if they have a exemption request, which I would consider to be a choice to identify that here, can do so. And there are now publications that have come out first through the EEOC that identified some of the things that employees and employers can do. In addition to that, now I do know the Department of Health has issued guidance related to healthcare workers. It's Department of Health issuance 505-160, specifically related to vaccination requirements and what is available for employees related to the exemptions and how that works. So that's for healthcare workers. And yesterday, or maybe it was Monday, I do know that OSPI put out their instruction, their updated instruction related to, OSPI's Office of Superintendent of Public Instruction. They put out their identifications for this information. It was updated on August 23rd, and it identifies the availability for the choice related to exemptions, either being disability related or religious exemptions. the identification of what is allowable is placed in sort of both of these pieces of information. And to the extent that employees or employers want to take a look at what your legal rights are, there is some guidance here in dealing with that. Although I will throw out a caution to all employers that are out there, I would actually encourage you to be in communication with your own employment attorneys, because I personally have some questions over some things that were identified here about employers' obligations. So any of you who are discussing this issue with any employers, I would encourage a discussion with their own employment attorneys. But overall, I've looked at this issue a lot, so I'm happy to answer any questions from the board. But Dr. Cleary, the legality of it as of this date, DOJ and EEOC both say it can be done. The governor has identified his basis for doing so. He has issued his mandate, but he has also, and again, Dr. Barg, this is an area I disagree. The exemptions are available for employees in order to protect your own federal rights, which they're entitled to do. So I know that was a lot to absorb. I wanted to make you all as board members aware of what is out there and what's going on. I think it's a challenging situation. We've talked about healthcare workers, but school districts, I mean, like this is a tough thing to work through right now. So to the extent that the board has questions for me, I know I talked too long, sorry.
I do have a question, Mr. Elliott. When I was on a call with Dr. Lindquist from the Department of Health, he made note that they were going to be losing a good chunk of staff from even the Department of Health in the state of Washington because they've declined to get the vaccine at the Department of Health level. And he went on to further state that they do understand, the governor has acknowledged that, and this probably pertains to what you're speaking about, that even though he's mandating that employers require this, and so is the employer, then, according to Dr. Lindquist, the employer then becomes liable for any adverse impacts that requiring such a vaccine would potentially have on an individual employee. So if they've made it a requirement to be employed there, that employer then is responsible or liable for any costs associated with treating someone who has an adverse impact to the vaccine. And that Dr. Lindquist said that they realize that, you know, employers are being required at this point to take on a certain amount of liability, and that that is, quote, still being flushed out, end quote.
I'm not sure how to deal with that as it relates to Dr. Lindquist and his comments. I mean, as far as vaccine issues and liability, I do know, and this might be beneficial for the board to understand. I mean, there's actually a vaccine court. It's something that's interesting. So I know people want to know about liability and how that works. There's actually a federal court that exists on that degree. I don't know whether he's talking about costs associated by employers and how things would go on that area. Maybe he was talking about their potential liability to their employees related to their decisions. Is that what you're talking about?
Yeah, was that that it was still being fleshed out, the cost, who would be liable. So if an employee was required by their employer to get the vaccine and they had an adverse impact, then who would be liable financially for the care and treatment of that employee who experienced an adverse impact, because it would fall under that was the EEOC, I believe I had read also stated that if you're going to require something for employment and then there was an adverse impact, that the employer becomes responsible to make the employee whole since they made it a condition of employment.
I can't speak on that, Commissioner. I mean, to the extent that maybe he's viewing it as a labor and industries injury, I don't know. I mean, I honestly not an area.
He seemed to know. He said it was still being flushed out. So I guess that's probably the concern, is that we're making a requirement of people to go and get a vaccine when a lot seems to be still being flushed out.
Well, I would say there is something that doesn't need to be fleshed out any further, and that's the obligation on the employer to comply with federal law. I mean, like there's nothing to be fleshed out in that area. The law is pretty clear on what employers have to do related to identified exemptions or accommodation requests under either ADA or Title VII. That doesn't need to be worked out, but who's going to bear the responsibility if someone gets a response? Way beyond me.
I'd like to comment on that, and thank you for the conversation, Mr. Elliott. it seems to me that if the state is, if the governor is mandating certain employers, that he's asking them to be kind of the middle point or the transition point between the governor and the actual employees, which puts a lot of, I think, undue responsibility upon the employer to take on that personal liability. And so, and as you stated, that if the employees file for an exemption under ADA or Title VII for religious beliefs, that the employer federally needs to allow that. And you know, then I would think that the state then would also have to allow that. I think it's a very precarious position that the governor has put the employers into.
I again would encourage employers to contact their employment attorneys and understand how Title VII and ADA works and what their obligations are. And I actually would just caution employers. I would say be careful about following everything that's been instructed here related to the governor on what you're supposed to do or what DOH says you're supposed to do, because to a certain degree, employers better beware on that one, because I would check your own law on that. So
I just read, this is actually a document that I received from the Washington State Department of Transportation, and it is their official form for a religious exemption request. Religious Exemption Request Form Proclamation 21-14 for the vaccine requirement. There are 2 questions that employees from the state would have to respond in order to receive the exemption, the religious exemption. The first question: you assert that you have a sincerely held religious belief or religious conviction that prevents you from receiving the COVID-19 vaccine. That's question 1. And I might add that you have to answer yes to both of these questions. So that's the first question. So if you state that yes, you have a firmly held religious belief and conviction that's preventing you from receiving the vaccine. But question number 2 from the state is, you affirm and agree that you have never received a vaccine or any medicine from a healthcare provider as an adult. So in order to obtain a religious exemption from the state of Washington, since turning 18, you could have never received a vaccine or medicine from a healthcare provider as an adult.
Does the document state that you have to say yes to both?
I'd be happy. I've got I'll send it to Ryan right now. I've just got a photo of it. So I'm sure what I'd prefer to do, Dr. Cleary, is I'll find it on their website and send a link directly so it's from a verified source.
well, I would throw out the idea that if there's any employer that's going to review that and think that's a good idea, I would tell them to review Title VII, because that's
that won't hold up.
So Commissioner, so you know, there has been an opportunity for employees to identify these exemptions and accommodations. That's not being changed through this mandate. That choice is still available for people. And, you know, employees have the opportunity to prepare a letter identifying what it is they believe and what accommodation they're seeking under Title VII. And the employer has an obligation to be engaged in that process. And to the extent that some employers are going to choose to do things differently, they better do so at their own peril. So
I do appreciate that comment, and I would say this, that I'm in agreement with that. That is an individual employer decision. I do think, though, that unfortunately a lot of employers are small. They do not have the ability to likely have someone such as yourself on staff or are on the ready to make this decision and how they should create exemption forms and how that process should go. I know I've received phone calls from even privately held medical facilities that are trying to figure out what they're supposed to do as far as what is the process for creating an exemption. Does it need to be a panel? What should it say? It's very confusing. And so for that, I'm in support of Commissioner Lindy's motion for the fact that I think it provides what I would hope is that from the state level, we need to have it be something that each employer needs to figure out for themselves how they're going to operate, and not under duress of a time frame here, where we have put people on the precipice. They've got to act quickly. This isn't just October 18th. The governor's made it very clear that you have a specific timeline for which you have to receive even that first vaccine. And obviously, as our conversation has reflected, there are a lot of unanswered questions here that if we're talking about it, certainly the employers are talking about it with their attorneys and are very busy. So I'm supportive of the idea of removing the mandate. Again, going back to the idea that this is something that is available. We can encourage people to, as we've said, speak with their physician, make an informed decision. But it is something that cascading a waterfall down to a deadline that's arbitrary at this point, I just don't think, especially when we're talking about a personal public procedure, or excuse me, a personal health procedure, is something that is never a good idea. And so because of that, I'm supportive of that. What I would say, Commissioner Lindy, reading, thank you, Ryan, for sending that. I don't know if we need to make a friendly amendment. I'd be willing to make a friendly amendment to strike the immunity test, as you indicated, that after Dr. Atterbury's comments maybe was not appropriate. But I would like to offer a friendly amendment that states that we are that removes the immunity test. So ending the sentence at COVID test, and that we would actually we recommend that the governor rescind his vaccine mandate. And then so
I don't think we ever had a motion or a second to the motion of the original statement.
That's true. I don't think it did receive a second. Commissioner Lindy, would you like to make your motion?
Well, let me, yeah, I can, I can remove it, I guess. Well, I mean, that's not what I could say. I guess that's the way what I wanted to say. Well, the motion was, and I did take off those last 4 words, so it would read as follows. Although no vaccine is ever risk-free, the COVID vaccine has been shown to be safe and effective. However, due to the resistance to the COVID vaccine among some members of the public, we recommend that Governor Inslee give alternatives to the vaccine requirements, such as a weekly COVID test.
And are you making that as a motion?
That is a motion, yes.
I would offer a friendly amendment.
Is there a second to that motion?
I'll second. And then I would offer a friendly amendment. We recommend that Governor Inslee insert rescind the vaccine mandate and offer more.
Dr. Clary,
Sorry.
no, after you, sir.
Yes.
I was just going to say that I'm not willing to insert the word rescind into the language. I want to leave it as it stands.
Yeah, Ryan, I was hoping you could go through the process because we have 2 separate issues now.
Yeah, so we do have a motion on the floor, and then also and that has been seconded, and then now we have an amendment that would need to be seconded.
I would second the amendment.
So then now we need discussion on the amendment.
Well, personally, I think we've moved out of the role of the Board of Health to come up with another proclamation or letter that really has no bite to it. There's no use for this, and likely will be no response. To go back to Commissioner McKinney's statement that this is what legislative bodies need to create rules. I think this is something that belongs in the hands of the legislators, the elected officials that are here, and you can make these statements from your position, your political position. But this is, again, mixed messaging, to use that term, to come from the Board of Health. I don't think it really reflects the Yakima Health District's best interests. And I don't, in terms of both inhibiting more communication with the Department of Health, but also in achieving our desire to reduce illness. So I'm not in favor of this coming from the Board of Health. As individuals, I think it's fine if you want to send those letters out.
Dr. Cleary, I'd like to be patient to allow the board members to speak, but I would like to share a perspective, please. Thank you.
Would anybody else like to contribute an opinion?
So Commissioner McKinney, you made the motion for the friendly motion. Do you want to defend that position?
Absolutely. To your good point, Dr. Cleary, thank you, that we do not have two-way communication. So this is our only way of communicating that we disagree with this mandate. I also agree with you that, yes, I've stated the legislature needs to become involved. My hope is that by rescinding this mandatory mandate, that it will cause our legislative body to call a special session to end the emergency powers that exist so that our legislative body can determine as a voice of the people how we as a state, through our representatives, want to continue and whether or not we want to see a mandatory COVID vaccine as voted on by the people and discussed in the public forum, rather than have that decision made under a temporary order by one person. And so it does send a message. It's the only way we send a message. And so I would say that this is the most important duty that we have, is to at least be a voice of reason, and hope that as a unified voice from the Yakima Health District Board and others, there are health boards across the state and other municipalities who are coming out and making certain resolutions and proclamations to state, no, we don't have communication with you. We only have one-way communication. So the only way we can speak out on behalf of the people that we represent is to tell you that we decline. We do not accept this as the formal way to move forward with the vaccine mandate, and we want to see our legislative body come back and discuss the matter in an open public forum.
And I will just add to that my agreement that the more voice we have, we have voices individually selected, those of us that are elected, people in the community have an individual voice, but the opportunity to have a united voice from various boards of health, I think, is equally important. I think the more voices and the more the government hears, the more opportunity we have to urge the legislature to move forward for a special session to counteract. Thank you.
Dr. Cleary, I'd like to share perspective, please.
Yes, thank you. And I would like to hear from our public health officer as well.
Thank you so much. I recognize that the conversations are spirited. I recognize that there are heightened perspectives on individual choice and concerns about one person having that authority to do so. I recognize that this is an era of tremendous compromise and frustration. But I will also share that I believe that the board choosing to take up discussions that largely are out of the control of the Yakima Health District is actually counterproductive to us keeping the community safe. We have had a divided board and a great deal of contentious discussion over the last 8 and 9 months. And my concern is that we are not united on what we can control. I recognize that there's concerns around vaccine mandates, but that's not something that we at the health district can control. That is something that comes from the governor's office. We cannot control the decisions that are made by private entities about how they choose to interpret that. I recognize when people say, and I understand the concern about two-way communication, but when I hear that the only way this can be done is through the Board of Health, I think that's actually not true. I think that there are many avenues that elected officials and representatives of local government have to share their concern, and I welcome that, and I think that that's certainly an option for every person in that kind of position of authority. Individuals have the opportunity to share that. But I think that it's counterproductive to spend our valuable time on things that we can't control when we are in the midst of a fight against a very deadly virus. Our focus, in my perspective, is that we should be focused certainly on keeping people safe, but also using all of our time collectively to make the difficult decisions to prepare for what might be a very difficult fall.
Dr. Bard, do you have a perspective on this?
Yeah, one of the things that's present in the papers that I reviewed regarding the efficacy of mass vaccination is that mandates actually end up causing more people to participate in whatever the health measure might be, always over voluntary. So one of the issues we have to deal with regards how much we have to do to get rid of the epidemic. And the more we do, as I said before, the better off we are. And if mandates increase the number of people vaccinated or wearing masks or staying 6 feet apart whenever they can, the faster I think the pandemic will scroll down.
Call the question on the motion and then the friendly amendment, as both have been first and seconded.
I'm not quite sure what the amendment is.
Excuse me, Mr. Lindy?
Are you talking about my amendment that by striking the last 4 words, or is there an additional amendment?
I know Dr. Cleary had wanted Director Fresco and Dr. Barg to provide their opinion, which they've done, and I don't know, it didn't look like anyone else had any further comment.
No, the amendment, Mr. Lindy, is the one that Commissioner McKinney put forth to include the terminology rescind.
Yes, Commissioner Lindy, I believe that your original motion had not been seconded yet, so then you made the change and then that was seconded.
Correct.
However, the call to question is on the friendly amendment offered by Commissioner McKinney to include the word rescind. That's what we should be voting on.
Correct.
Can the point of information, can you please state the full amendment that we are voting on?
I'm happy to do that. So my friendly amendment would mean that the motion in full would read as follows. Although no vaccine is risk-free, the COVID vaccine has been shown to be safe and effective. However, due to the resistance to the COVID vaccine among some sectors of the public, we recommend that Governor Inslee rescind his vaccine mandate and offer more alternatives to the vaccine requirement, such as weekly COVID testing.
Okay, so Dr. Cleary, would you like a call for vote or a roll call for vote? Okay.
Yes, please. Thank
So
you.
if you are in favor of the amendment, please state yes. If not, please state no. Commissioner McKinney,
Yes.
Commissioner Lindy,
I'm still thinking. I'm sorry. Let me, come back to me, please.
okay. Mayor Byers,
Yes.
Council Member Duval,
No.
Dr. Atterbury,
Yes.
Dr. Cleary,
No.
was that a no? Dr. Cleary? could you please
No.
state- Okay, thank you. And then Commissioner Lindy, Commissioner Lindy, we can't hear you.
Yeah, that's because I haven't said anything yet.
Oh, okay.
Yeah. I'm gonna vote no.
Okay, so the vote is 3-3. So move on to the actual motion.
Yes,
There-
please.
Sorry, so we haven't articulated what to do. I don't know if this board's been advised on what to do if there's a tie. Do we have any?
A motion requires majority vote, which would be 4 votes to pass.
So this would be a clear indication where even one board member being gone, that there's a possibility for a tie vote.
Correct. If there were 2 gone, we wouldn't have a tie.
I know, boy, something we just didn't think a couple months ago would ever be something we'd have to encounter, yet here we are.
Well, yeah, there's already a process in place that that you have to have a majority vote on any, so 4 votes would mean to pass any motion.
Okay, so can we have a vote on the first motion, please?
Just a point of clarification, Dr. Cleary, with the first motion failing, is there any need for the amended motion? Because the first one failed.
No, the amendment.
We
The
just-
amendment.
We just voted on the friendly amendment and that failed. So we're back to Mr. Lindy's motion. Commissioner.
So do we want discussion or call vote?
Might make sense to read the motion again so people know what we're talking about at this point.
Okay, so the original motion states, although no vaccine is risk-free, the COVID vaccine has been shown to be safe and effective. However, due to the resistance to the COVID vaccine among some sectors of the public, we recommend that Governor Inslee offer more alternatives to the vaccine requirement, such as weekly COVID test. Dr. Cleary, are we doing discussion
Okay,
or vote?
I believe we've already had discussion on the motion, so we can proceed to a vote.
Okay. Commissioner McKinney,
Yes.
Commissioner Lindy,
Yes.
Mayor Byers,
Yes.
Councilmember Duval,
No.
Dr. Atterbury,
Yes.
and Dr. Cleary.
No.
So the vote is 4-2 in favor.
Discuss how this is going to be communicated to the governor's office and how each board member is going to be receiving a copy of the communication.
I'm sorry, Commissioner McKinney, you broke up at the beginning of your sentence. Could you start again, please?
Sure, I'm just curious, do we need to also discuss how this would be provided to the governor's office? So that he's made aware that this is a Yakima Health Board decision?
Well, I've had discussions with James Elliott about this issue. We've had this happen in the past, and so we've been instructed that that's a distinction we make between the Yakima Health District and staff and the Board of Health. So, Mr. Elliott, if you'd like to share a perspective.
Yeah, we kind of went through this with Commissioner Lindy previously. My suggestion would be, since Commissioner Lindy made the motion to prepare the letter, allow the board members to review. And I think because you have two board members who have voted in opposition, they should also be provided the opportunity to identify their opposition to it as well on it. I think that makes the most sense. At least then Councilwoman Duval and Dr. Cleary's negative vote on it can be identified for the record in addition to what we've done here today. I think that's the best way to do it. So.
I agree, that's a great suggestion. So does that also mean that the last vote that went through, that communication to the governor's office has not yet been completed? So.
Well, those are all things, in my opinion, some board members are making these motions and they want that viewpoint to be only by the board. So if that's what you guys want to do, then I think that the maker of the motion should be responsible for that communication. This has nothing to do with the health district, and I don't think that we should put this on them to draft a letter that needs to be sent to the governor on our behalf. That's wrong.
My understanding is that the motion from the previous health board was actually drafted and it was signed by Commissioner Anderson and sent to the governor. I believe that has happened.
Sure, I'm happy to hear that. Are we able then to get a copy of that? And then are you, Commissioner Lindy, going to take care of this particular one and provide a copy to all board members?
I can do that for this one.
Thank you.
I do agree with Mr. Elliott and with Ms. Duval that the dissenting votes should be noted on the letter.
I also agree with Dr. Cleary in that it's an altogether more productive motion to be promoting vaccination and doing all we can to promote vaccination rather than telling the governor over and over again that we disagree with his orders. Obviously, he doesn't care that we disagree with his orders, but proposing the benefits of vaccination should be the driving force of this board and this county health department, period. That's full stop.
Thank you, Dr. Atterbury. I agree with you 100%. And my only good thought about this is at least this is not a proclamation and media release. If it just goes to their office, it can go right in the trash with most of what we send. So that'd be fine. And even though it is an opportunity for Ms. Duvall and I to make a statement, I'm not sure that we should, in a letter that was adopted by the group and voted by the group, I'm not sure we should be adding additional statements at the end. It would be a good opportunity, but I don't think that's appropriate to do that. If we just list the names in agreement and those in dissent, that would be fine.
I'm going to agree with that, Dr. Clary, because I know that on the, as Yakima City Council operates, for example, as a governmental body, that once a decision is made by a majority vote of the council, that the council stands with that decision, and people can always see the public vote record, but that we do not then go back and discredit any work of the council with further statement.
Right.
So Dr. Atterbury, since you mentioned, the idea of getting behind and promoting the vaccines, I mean, do you have anything that you are thinking of proposing along that line?
Well, I would just state that, I mean, the massive data that we have collecting right now is that the hospitalizations are tremendously in favor of those who have been unvaccinated. In other words, people being hospitalized are unvaccinated. We just got to pound away at that message. Eventually, people will get that and say, well, hell, I don't want to be hospitalized. I better get vaccinated. That is the take home point. That is the message. That's the one we should continue to pound on because it's accurate and it's based on math. And I'm a big believer in math.
Well, and I agree with you as well on that. We should push that message.
I'm not sure that message isn't being pushed extensively. So I know when I'm on Facebook, every single post I see from private, it doesn't matter who it is, there's a little box that says CDC, search for a vaccine. I follow the CDC, I follow all the Department of Health, and I recommend everyone else do so, the Yakima Health District. So my personal Facebook feed is absolutely filled with opportunities to read and learn about the COVID vaccine.
For benefits to both your and every person out there's mental health, I would recommend getting off Facebook.
Yes.
So comment to that.
One of the issues that is really concerning out there, as I was talking to a physician last week, he had a patient of his bring to his attention the VAERS website, and it was claiming that, and I think you all know that's the vaccine adverse event reporting system. Anyway, that it was reporting this unreal amount of complications, adverse events from the COVID vaccine, from the COVID vaccine itself. And so the doctor asked this patient to send him the link, and he found out that this link was in fact a copycat. It was not an actual CDC link or CDC website. It was VAERS.com instead of VAERS.cdc.gov. So there are actually copycat websites out there that are claiming certain things about the vaccine that are simply not true. I have no idea why someone would want to do that, but it's out there.
Well, Commissioner Lindy, actually, I'm glad you brought up that point. There are many people who are being misled, and I think one of our opportunities is to convey to them what the serious scientific data says. But also, I'm asking all of us as colleagues in pursuit of the best interests of the public to consider that being united and doing all we can to ensure the safety and benefit of our community is our highest priority. Many people have conveyed to me their concern that there is a division between the Board of Health and the Yakima Health District, Board of Health members and Yakima Health staff. That's concerning to me because we are really fighting a dramatic event here, and it could get worse. So I'm asking us to think, if you would, to accommodate me in thinking about all the things that we can do that are within our control to make this community safer. There are many, many, many things to be angry about. There are many things to be frustrated about, and there are going to be many decisions that we don't agree with. But many of those decisions are not in our control. What is in our control is to work collectively in the best interest of keeping this community safe.
I would state just publicly, Andre, that I have absolutely no qualms whatsoever with the Yakima Health District and their staff and the very noble job they've been doing under non-perfect circumstances. So I want to state that publicly in case that might be floating around out there that I might be one of the dissenters. I'm not. I think that what they're doing is tough. It's hard. They're doing a good job. We just got to keep promoting the message because it's our only salvation is truth.
Okay,
I
on
would
that
add to
positive note,
I moved to.
Sorry, I would
Thank
add
you.
to that, Director Fresco. Certainly, if there's an appearance of being at odds, I think it's because we are talking about something that is impacting people on an individual level and as a family and as a community at large. I'm highly supportive of all efforts that provide opportunities for people to make decisions that ultimately are their own. So we can promote the idea of vaccination. We can promote the idea of social distancing. We can even promote the idea of masking or whatever it is that you would like to do as a personal mitigating added layer of protection for COVID-19. But I am fully supportive of the staff providing opportunities for education for people to make a decision on their own.
okay, and I think we have a motion from Mayor Byers to adjourn. You have a second?
Second.
Okay. Thank you all.
Bye.
We are adjourned.
Take care.